Okay, hello everyone. Good morning, good afternoon, good evening. Thank you all for joining. So this is Kinzang here from OIE Tokyo office, welcoming you all to this webinar session on the occasion of World Rabies Day, which is the 14th year since the World Rabies Day started to be observed since 2007. And this year, as you all know, the theme for this year's webinar is to end rabies, collaborate, vaccinate in the Asia-Pacific region. So we would like to welcome all the participants from the Asia-Pacific region and also the speakers to this webinar being organized jointly by the Tripartite, that is the Food and Agriculture Organization of the United Nations, the World Organization for Animal Health, the OIE, and the World Health Organization, that's the Tripartite. So we once again welcome you all to this webinar. And for your information, we will be recording this meeting, this virtual meeting, and we request all of you to kindly keep kindly keep muted so that there is no disturbance while we have the meeting on. So as you can see here, today the main objective of today's webinar is to keep the agenda of rabies, which is a neglected disease, high on the agenda of all the stakeholders in all the members of our region, and most importantly on the agenda of the policymakers, of the implementers, and all the stakeholders in the region. So before we start the actual session, I would like to first of all welcome Dr. Hirofumi Kujita, our regional representative for the OIE in Tokyo, to kindly provide his opening remarks. Dr. Kujita.
Thank you very much, Kinzan. Good afternoon, good morning, everyone. I am Hirofumi Kujita, OIE Regional Representative for Asian Pacific. On behalf of the organizer, the Regional Tripartite, FAO-OIE and WHO, I am very happy to welcome all of you to this webinar to celebrate the 14th World Rabies Day. As you must know well, the Tripartite has been collaborating for many years to promote the One Health approach in the prevention and control of zoonosis. Rabies has been priority target for the Tripartite. And in 2015, the Tripartite and GARC, Global Alliance for Rabies Control, launched the global framework to eliminate the dog-mediated human rabies by 2030, known as 0 by 30. In this region, the Tripartite has been working closely together to organize many relevant events or provide support to members to raise awareness of people, enhance the multi-sectoral collaboration at regional, national, and local levels, and to promote the fight against rabies. I'm not going into details, but I believe this webinar will give you a good opportunity to review and update the relevant progress on rabies control in this region and renew our commitment to achieve the global target 0 by 30. I would like to express my sincere appreciation to the speakers who agreed to join this event and make precious contribution to this webinar. I wish you have a fruitful webinar today. Thank you very much. Over to Kinzan.
Thank you, Dr. Kujita, for your welcome remarks and also for highlighting the key objectives and the background of this webinar. I'd like to remind all the attendees here that we shall be uploading a copy of the presentations and then also the record here on our website. So please do not worry about the presentations. And then also this webinar is supposed to be more of interactive sessions. So please, if you have any questions, please put your questions into the chat box. Unfortunately, because of lack of time, we will not be able to address your question through voice. But if you have any questions, please put your questions into the chat box. And I would like to now request all of you to please turn on your camera so that we can take a photograph before we start the actual session. May I request you all to, for those of you who are willing, to kindly put on your camera so that we can see how many of us have come together to commemorate or to support this strategy. And I request Lisa to kindly take the screenshot. So we'll have about 20 seconds for this. So Lisa, when it is done, please let me know. Is it okay? Thank you all for, I think it's good to see you all live here, and thanks for your support. So now we'll move to the next agenda on our thing. So as you can see, we have 3 sessions today. Session 1 will be moderated by OIE, session 2 will be moderated by FAO, and the third one will be by WHO. So for the first session, I would like to now introduce the first speaker, who will speak about the UAR's activities to move into phase 2 of the global strategic plan. So Dr. Rachel, she's the speaker for this first session, and she holds a Bachelor of Veterinary Medicine and Surgery from Murdoch University, Australia, and a Master in One Health from the University of Edinburgh, UK. Before joining the OIE, Rachel was a consultant in the WHO in the Neglected Zoonotic Disease Department. Currently, she is working as the Global Rabies Coordinator at OIE headquarters on behalf of the Tripartite, and she's working to maintain strong synergies between the Tripartite to achieve the global strategic plan. So let's have the first presentation.
Good afternoon, everyone, and happy World Rabies Day. Thank you for joining this webinar today, and I hope you are all keeping safe and well in this unusual time. Thank you too to the organisers of this event for giving us this opportunity to share updates from the global level activities towards the 2030 goal. I will be giving this presentation on behalf of United Against Rabies, and I am aiming to give you a brief overview on the first phase of implementation of the Global Strategic Plan 0x30 since its launch in June 2018 up until now. Following this, I will discuss the next steps from here as we transition into phase 2. The Global Strategic Plan was developed by the tripartite organisations and GARP, following the global call to action in 2015. It was developed to provide an achievable goal and a common plan, and this Global Strategic Plan presents a coordinated, country-centric strategy to eliminate human deaths from dog-mediated rabies by 2030. The plan integrates rabies prevention with other healthcare interventions in a One Health approach to strengthen health systems and engage stakeholders throughout the world in the fight to end rabies. The Global Strategic Plan prioritises the changes that are needed to reach 0x30 into 3 objectives. Objective 1 is to reduce human rabies risk by increasing access to healthcare, medicines, vaccines, by promoting mass dog vaccination, and by improving awareness and education. Objective 2 is to provide guidance and data. This is done through effective policies, guidance, and governance, but also by ensuring reliable data to enable effective decision-making. Objective 3 is to harness multi-stakeholder engagement and to demonstrate the impact of our activities. This will help sustain commitment and resources. As there are 105 dog rabies endemic countries, we used a phased approach to break our work plan into achievable target objectives. In Phase 1 from 2018 to 2020, we began by engaging our first group of countries with the greatest chance of success. Our core activities included supporting these countries to prepare robust, budgeted, effective and sustainable national rabies elimination plans that followed a One Health approach, and also by facilitating the coalescence of these plans into a coordinated regional effort. We now have our first annual report, which highlights the progress that has been made on these three objectives and the global work plan since the launch of 0 by 30 in 2018. The report was compiled by each of these four organisations, and there has been significant improvement made in the past couple of years in the provision of policies and guidance, with these new policies following a One Health approach. Progress is reported against selected indicators for each of the outlined objectives, and the report provides concrete examples of successful implementation in countries. This report is online and available at the provided link here for any that are interested in the finer details. However, I hope to outline some of the highlights in the coming slides. We have made very promising progress under Objective 1. Gavi, the Vaccine Alliance, has prioritised human rabies vaccine for post-exposure prophylaxis in its 2021 to 2025 strategy. Unfortunately, due to the COVID-19 crisis, the rollout of this has been postponed, but their support will make human rabies vaccine available and strengthen PEP programs in eligible countries that request it. More and more countries are accessing the OIE Dog Vaccine Bank, and since the launch of 0 by 30, the OIE Vaccine Bank has delivered over 2 million doses of quality assured dog rabies vaccines to 13 countries in Africa and Asia. Additionally, 79% of countries with human rabies cases have had health professionals involved in training sessions for human rabies prevention. And while we have all seen the growing success of World Rabies Day events, there is enhanced rabies awareness in several countries and regions worldwide, beyond just those of World Rabies Day events. Under Objective 2, OIE and WHO have updated global standards and procedures to reflect best practice in rabies prevention and control, with a One Health approach being central to these changes. The Tripartite and partners have provided capacity building trainings with regional and national rabies specific workshops in more than 60 countries, and tools for countries have been created, updated and refined, and I'm sure that our colleagues in further presentations will elaborate on this further. Unfortunately, many of our planned on-site capacity trainings have been mostly halted due to COVID-19. However, we have seen a myriad of online trainings and webinars instead, such as this one and the United Against Rabies global event on the 22nd of September. There has been significant capacity building to improve laboratory diagnosis of rabies in over 50 countries, and efforts are being made to improve and facilitate data reporting and collection in countries, and also to promote the sharing and analysis of this data to enable better decision making. There have also been big steps made in linking global databases and sharing of selected official data across sectors at a global level, which avoids duplication. As for Objective 3, to sustain commitment and resources, the Tripartite and partners have worked to maintain the high pace of advocacy, as have countries, and this is exemplified in this webinar by several success stories of national commitment and resource generation. Finally, the creation of the United Against Rabies Forum has just been announced on the 22nd of September, which will help galvanise this sustained commitment and resources. The Global Strategic Plan is now moving into Phase 2, and this transition was marked by our United Against Rabies One Health in Action Partnering for Success event that was held on the 22nd of September. This event has been recorded and is available to watch for those of you who are unable to attend, but a key objective of this event was to bring stakeholders from both the rabies community as well as the wider human and animal health sectors to announce the creation of the United Against Rabies Forum. We need the engagement of a wide range of sectors and stakeholders to continue moving forward, and this forum will provide an enabling and inclusive environment where members and countries can focus on activities that efficiently contribute to 0 by 30, while sharing their knowledge, experience, ideas and information. Forum members will include intergovernmental organisations, NGOs, national governmental institutions, private sector, philanthropic foundations, and academic and research institutions. Working groups will be established to contribute to activities that implement the objectives of the Global Strategic Plan. There are still many challenges ahead. We need more stakeholders, larger scale resource mobilisation at a global level, and sustained political will. However, we have made significant progress, and with your support we can continue to make bigger strides towards rabies elimination in Phase 2. Together, we can make rabies elimination possible. Thank you so much for your time and the incredible demonstrations of dedication and effort from all of our colleagues and partners here today. We wish you a very happy World Rabies Day, and we look forward to much continued collaboration in the near future. Thank you.
Well, that was Rachel Tidman from the Global Rabies Coordination Office in OIE headquarters on behalf of the Tripartite, explaining about the global progress that has been made so far. And since Rachel is not around today, but if you have any questions, please do let us know through chat, and we can surely pass it on to her so that we can then let you know if there are any, if you have any questions. So moving on to the next speaker. So we have Dr. Murugan Apupillai from Mission Rabies. So I'm going to just very briefly explain about his background. So Dr. Murugan Apupillai is a veterinarian by profession and is the director of education for Mission Rabies based in India. Out of his passion for education, he experimented teaching rabies and got the credit of being the founder of education for Mission Rabies project, and enjoyed working for this project in Tamil Nadu, Jharkhand, and Goa states in India, and Malawi in Africa. In addition to creating awareness to understand dogs and their behavior, his primary focus has been to establish that education and awareness could make a great difference in people's lives, and that could support for the mass stock vaccination, which is actually the key component for rabies control. So he has used his experience working with various governments in the past to successfully collaborate Mission Rabies projects with these groups and generated the greatest support towards making Goa state rabies free. So I would like to now invite Dr. Murugan to kindly make his presentation on his experiences of using the risk communication, effective risk communication in the Goa state of India.
Good morning, everyone. This is Murugan Appupillai, Education Director for Mission Rabies, Worldwide Veterinary Service. I hope you all know that Mission Rabies has demonstrated rabies could be controlled and eliminated at state level by mass vaccination supported by education. Let me share my experiences in rabies education, which is vital to prevent rabies. The objective is to educate children in the dangers of rabies, and the ultimate goal is rabies elimination by supporting mass vaccination. The education is fun and engaging, but appropriate and accurate. It creates attention. We teach rabies and we tell them how is it transmitted, and we impress upon the children it is 100% preventable. And we teach them how to stop dog bites by understanding dogs, avoiding dog bite, and we tell them about the rabies first aid, the water wash, the ARV injection, and we also combine with the demonstrations. We talk about the benefits of vaccination as well and the benefits of population control. The target children are 5 to 15 years, but the priority is always the rural poor who are more vulnerable for dog bites. The duration is 20 minutes, 30 minutes, and 1 hour. We cover 85 to 90% of the schools in Goa. The retention of knowledge is managed by our repeated visits every year and doing the quiz type programs. The method and content of education depends on rural or urban, primary or high school or community. If it is primary, we have to increase the body language and we have to increase the number of demonstrations. If it is community, we have to talk about the local happenings to attract the people. Thus, we are creating communities who know how to protect themselves from rabies and who also support us. in our project. Every year, we visit 1,800 schools, and since 2014, we have covered 1.3 million children, 53,000 teachers, and 240,000 community people directly. The evaluation of the education is done by KAP survey. The teachers' feedback and the quiz sessions we conduct every year also help us to understand the children, and especially the field children, that is the educated children in the field, their demonstrations that they have done very well by calling us on the hotline number or supporting for dog bite victims and spreading the message is absolutely fantastic. And whenever there is an outbreak or when there is a positive case, the education team rush to the village and they visit the people and tell them the symptoms of rabies and ask them to call our hotline number whenever see a case of rabies in the village. And they also help these dog bite victims to get water wash and medical aid, and also support this ring vaccination in the village and go and brief the veterinary hospital people and the panchayat authorities about these events. Especially updating the government and elected leaders is very, very important. This municipality and panchayat are the departments in charge of the dogs. So we always conduct meetings from time to time for the municipal and panchayat leaders and tell them about the project and tell them about the vaccination. And daily vaccination update through WhatsApp group of government and other stakeholders, and which contains also all the veterinary doctors in the state, is very important. The everyday vaccination numbers and the place of vaccination and other mission rabies events are also updated through the WhatsApp. The progress and experiences are also spread through the newspapers and electronic media from time to time. The elected leaders and the government heads are also invited for many of our events. See, this secretary to government is inaugurating the rally. On the right side, the chief minister of Goa is attending our World Rabies Day program. And there are a lot of success stories, especially the educated rabies educated students who are almost like volunteer, who are supporting our project in a big way. There are many success stories on them. The key risk workers like postmen, electrician, firemen, lifeguards, sewage workers, migrant and construction workers, they are the main dog bite victims, and they are the most best beneficiaries of mission rabies education. The key community groups are the women's group, like self-help group, Anganwadis, and Goa Panchayat Mahila Sabha. And we are able to appreciate that there is a great change in their attitude towards dogs after our lessons. The rabies educated teachers as well help to review the lessons with the students. These are some of the community awareness events like rallies and the postman event and the lifeguard events on the right side. And there are a lot of challenges we overcome. To tell you a few, one is during 2013, Mission Rabies inaugurated the trial vaccination, rabies vaccination in 14 cities, in which Madurai is one. I was posted at Madurai 2 months ahead of the project program, and I landed and I went to the field and started taking these trial vaccinations. And these villages, these residents, they came and objected to that, and they asked me, what are you doing? I am vaccinating the dogs and keeping them safe for you. They said, no, no, if you vaccinate the dogs and take it with you, then it is absolutely fine, we are thankful. Otherwise, we don't want your service. Then I approached the district collector and requested him to give me an order to go to all the schools to teach the children. Then I as well asked him to provide me with one vehicle and a driver. Then I went to the schools and I just got the rabies education done and got all the children out of the stools on the roads, conducted a lot of rallies with the help of Rotary. Then there was some media attention. After this, we were able to do 8,400 vaccinations against the target of 3,500. Then in the case of Goa, for example, the Goans are animal lovers. Most of them are animal lovers. When we are doing the vaccinations, very rarely we get the death after the vaccination. Then it became a big issue. Then we do the post-mortem and we prove them and talk to them that the vaccination, their death is not due to vaccination, but it is due to distemper or heart attack or any other reasons. Then if you go to the Ranchi, Jharkhand, where getting the appointment in the private schools is very difficult. Due to the children are having a very heavy syllabus, the teachers are not able to provide us with the time. All they give is only 15 to 20 minutes during the morning assembly. We make use of that and do our presentations. Then if you go to the panchayat meetings, it is very difficult to get a panchayat meeting organized in Goa or elsewhere in the country, because the people are not gathering in one place. In the case of Africa, for example, if you go and tell the panchayat leader that you want a meeting, then the next day when you go, 99% of the villages will be attending, waiting for you. In the case of Savantwadi, Maharashtra, bordering Goa, it's a big challenge for us, because Goa is now rabies free. We don't have the rabies cases. In the case of the border, the Maharashtra dogs which are not protected and non-vaccinated are migrating into Goa through the borders, and then that becomes a big issue. We are now managing it. There are the mission rabies education has achieved so many, and in which one is the publication of our the education lesson in the test book of Goa State Government test book. And the second one is, for the last 2-3 years, we worked very hard to get the rabies messages published in the national curriculum in the teacher's guidebook of 8th standard. The government orders for doing all the activities is very important. For all our activities, we get the government orders, which is assurance. And in the case of African projects, we have extended our projects to Africa, and this Indian experience have been replicated in Africa. During the last SARE workshop by the government of India, they have recommended to follow the Goa model for rabies control in other states as well. And this is the lesson, which the 6th standard lesson, which is published in the test book. And the media support from time to time is very encouraging for us. And if you see this human rabies death during 2014, when we launched the project, it was 17, then came to 512. From 2017 September, there is no human rabies cases recorded in Goa. Of course, there are animal cases, as I told you, only in the border of 3 border talukas, but rest of the 9 talukas of Goa are also free of animal rabies as well. If you see the dog bites from 2017, it is increasing. This is due to the great awareness. And during 2020, the number of dog bites are less because people were not on the road. To have a successful rabies control, the education matter and the presentation should create a great attention. That is very important. The education team should support the vaccination and surveillance. That is very crucial. Training of teachers play a key role in our project. We already reached about 53,000 teachers in India. Actually, teaching one teacher is equal to teaching thousands of children. So that is how from the beginning we are doing this. The demonstration of our dedication to eliminate rabies and educating the leaders help to work very closely with the government, which is crucial for the success. Thank you very much for your attention.
Thank you, Dr. Murugan, for his presentation. So as I said earlier, if you have any questions, please do put in the chat box, and then after all the presentations are done, then we will provide opportunity, since Dr. Murugan is here in the meeting, so I think we can ask him to answer those questions. So it looks like Dr. Umme Ruman from Bangladesh is here. Thank you so much for joining us. And I hope you are now ready for your presentation. So can you unmute yourself? So before you present, let me first introduce you to the house here. So Dr. Umme Ruman Siddiq from Bangladesh, as you know, she also participated in the SARC Rabies webinar in May, and today again she's here. So thank you so much. And then we, as you all know, that Dr. Ruman, she works in the Communicable Disease Control Division of the Director General of Health Services in Bangladesh under the Ministry of Health and Family Welfare. Under her leadership, rabies elimination program is becoming quite a successful one, despite various challenges. You can see that the incidence of human rabies has declined over the years, over the last 10 years, and she has been working very closely with the various stakeholders, including the Department of Livestock Services, local government, NGOs, and other partners such as FAO, WHO, OIE, and US CDC. She has completed She completed her PhD from Tohoku University School of Medicine from Japan. So the next presentation is from Dr. Ume. You're on mute. Just can you unmute yourself, please? You are still not muted. Yeah. Okay.
Is it fine? Okay.
Yes. Yes. Please.
Oh, thank you very much. I feel very honored to speak in front of this August gathering regarding rabies elimination. Especially, I want to share some important aspects of rabies elimination in Bangladesh, how we are working and how we are collaborating, and especially for during this World Rabies Day slogan and rabies through collaborative approach. This is very important. So if we do collaborate with our specific stakeholders, then we can make the toughest thing very simple. So here today, I want to focus on some aspects of risk communication and how we work. We are working for Bangladesh. Actually, we are working under a national strategy with some specific activities. First one is advocacy, communication, social mobilization. As like other developing countries, like in Asian Africa, Bangladesh, rabies was endemic till 1,000 years, and people have idea that they can catch some either disease, or they can have the puppy inside their belly if they are bitten by dog, but not rabies. So they didn't have idea, or they didn't have knowledge, and we didn't have a very good strong strategy or policy for combating this disease, neglected disease. So in our strategy that was developed through multi-sectoral coordination in 1910 first, that was finally modified in 2012, sorry, it was 2010. The advocacy, communication, social mobilization was the key aspects that we had focused, that how we can make people know, how we can let people learn what is rabies, and it is 100% fatal, and by taking a specific post-exposure prophylaxis, we can prevent it 100%. So our ultimate goal is end rabies by 2030, according in line with global strategy. So, and we are working through different ways for risk communication. And we know in like other countries in Bangladesh, the highest mortality of rabies, the children are the major sufferer. So we take many different strategies to let people know. First one is go through Little Doctor program. That is a school-based program, school-based educational program, and we included rabies to let other students know through their peer students. We select 15 students from 5 different classes. That is previously it was first primary school based. In primary school, we teach them until 5th grade, and we select 15 children, 3 children from each for each classes, and let the different aspects of disease, especially 3 key aspects. One is so people can have rabies through dog bite or other animal bite, and through simple washing the wound with soap and water for 15 minutes, they can reduce the risk of development of rabies for 70 to 80%. And next one is if they go to the district Shodar hospital, they can have the vaccine for free of cost. These 3 simple messages, just children, they let them know to other children, other school children, and by this way actually we can reach to their family. In Bangladesh, we have more than 1 lakh, that is 0.1 million primary school previously. So we can, and at least in 1.1 million primary school, we have 1.5 million little doctor, and at least we can reach these 1.5 million families to their family members. And we know, so children, they are the most suffer, they're more vulnerable to have dog bite. it can be either by rabid dog or non-rabid dog, but dog bite is risk always. So they can freely go to their parents to let them know there is a risk for development of rabies, and it is 100% preventable. They can go for simple washing that is very available even in the poor setting also, just simple soap and water. And they can go to the district Southern Hospital to get further management. By this way, actually, to me, this is very good approach to reach the community people. Next approach is like during mass dog vaccination, we go house to house. We go just our team members go to the whole community, because we go for district approach. We cover all the upazilas, we cover all the sub districts, then unions, every villages. So by this way, actually, we can go to the people. So people are very interested why we're vaccinating dogs, how they can get advantage from this vaccination, such like this. And people actually they're much more interested, even they help this vaccination program. And during that master vaccination campaign, we do how to say miking, and also provide leaflets, or show them some audiovisual materials that they can know what is rabies, how they can be prevented from development of rabies, and it can be 100% fatal for their children and for them as well. There are actually a lot of incidences occurs, and just simply for ignorance, they don't go to hospital, or rather they go to the local like Oza or Kobiraj, like traditional healers. And when people understand that they have very simple remedy, and even Kobiraj himself cannot, if he is bitten by dogs or she is bitten by dogs, they also need to go to hospital. So they easily get motivated and they know where to go. And next one is, we also during this master vaccination campaign, we conduct one advocacy meeting, bring the local policymakers, local journalists, media people, local leaders, to make to develop the understanding, and to let people work together collaboratively to combat against this nationally targeted disease that is sustaining in our community for a long time. So this works very well. Sometimes even our counterparts, even administrative peoples, sometimes they don't know how we can prevent rabies. Even dog bite can through dog bite, there is a risk of development of rabies. So we get some administrative support from those peoples. So by this way, actually, this kind of risk communication works very well. In addition, we also take advantage through social media, and we also involved scientific community, like we do a scientific seminar to the medical colleges, to the veterinary universities and veterinary colleges. Sometimes students, they are not very much aware, because this is not a frequent disease. So even one student or one doctor, they didn't see any rabies patient. So they don't have very good understanding, and even the development of this or progress of management, like post-exposure prophylaxis. These we can just only through 4 dose or 3 dose intradermal vaccination, we can prevent this disease. And washing is now included as one of the very important part of post-exposure prophylaxis. And we take these kind of messages to the scientific community and also our medical students and medical doctors. And they are very much interested to work for this, and they can provide message to their community, to other students or other. And when they go for management, they can easily provide this standard post-exposure prophylaxis. Because in government hospital only, like how to say, we can reach 4,000, 5,000 or 10,000 doctors. But if we teach, if we can disseminate this knowledge to our medical students, to our veterinary students, they can disseminate thousands, 100,000 students or doctors. So actually, these are the very strong way to communicate the risk and to communicate the message that we can prevent this disease very easily. And another important issue is social media. We sometimes use social media, not sometimes, like through Facebooks. We have a very strong community of like its name platform. This is a organization of students, medical students and dental students organization. They have more than 70,000 members. So like this kind of platform, this kind of organizations, we just disseminate this information, knowledge. And through this actually other important issues like post-exposure prophylaxis or animal bite management, master vaccination, or surveillance, we can enhance and we can motivate people. So these are the very important aspects of risk communication that we try to follow. And by this actually Bangladesh have very strong collaboration and communication with the policymakers, with the stakeholders, like our livestock department, like our local government. And I want to, in this regards, I want to share one example. Like one suspected rabbit cow was sold to a butcher, and he brought this cow to slaughter, and he will sell meat. But one mobile team, they saw the cow, and he feels that it can be a diseased one, and he communicated with local Upazila livestock officer, and she reported that that is a rabid cow, suspected rabid cow, and it was buried. And when on that night the information came to me, and I communicated with that local Upazila livestock office, it was buried under 6 feet land. And when I communicated and requested her to collect the head of this cow, then he communicated with that authority that we have to ensure that either it is rabbit or not. That's what we have to do laboratory investigation. And finally she made it, and it was sent to the livestock research institute, and it was found that it was found rabbit. And we get back to the local authority and local peoples who were infected by this cow. And sometimes we get information from the local people, local CHCP, community healthcare providers, that some dog or some animal has bitten more than 10 or 15 peoples, and we try to communicate with our local and national livestock counterparts, and they help us. They collect the sample and test it, and just send the message to us that is rabbit, and we try to find out all these peoples who were bitten or who were affected by this rabbit animal. Even if it is non-rabbit, we send this message to them. Actually, this risk communication, to me, it should be within the stakeholders and within the community. And we have to identify the risk groups who are the most vulnerable people, and we're trying to do this. Still, we have to go a long way, although from 2010, now 2020, by these 10 years, the human rabies cases have been reduced more than 10 times, but still we have a long way to go. We have covered 60 out of 64 districts through at least one round mass vaccination. We have covered 3-round mass vaccination in 3 districts, and 2 rounds in 4 districts. And by this way, actually, and we have target for at least 3 rounds of mass vaccination in all 64 districts. We believe if we can stop circulation of rabies in dogs, then, and also if we can promote timely post-exposure prophylaxis, and we can let more people know and engage more people, like we say advocacy, communication, social mobilization. We want to make it as a part of social mobilization, and also one-to-one health approach. Then we can be successful, and we can really end rabies from not only from Bangladesh, from Southeast Asia and from all other parts of the world. And I think this rabies is a most very good example for practicing One Health, and also it can be example for other zoonotic diseases, also for other zoonoses. And as now the world is facing COVID pandemic, and these days actually it is becoming more and more challenging to bring people for getting post-exposure prophylaxis. But still we have to work hard, and I believe if we can get stick with this program, one day maybe we can get rid of COVID, but we have to focus on this kind of neglected tropical disease like rabies, and we can have a rabies-free world. Thank you very much.
Okay. Thank you, Dr. Ruman, for presenting your experiences on using the risk communication strategies in Bangladesh. So now for this session, we have the last presentation from Lao PDR. So Mr. Vatsana Kambongsa will make the presentation. So Mr. Vatsana is the Chief of the Lower Secondary Education of Ministry of Education and Sports for the Lao PDR, and he has been working as a teacher on physics in Vaccinate for 16 years, and also as a lecturer and the Deputy Chief of Physics Department. And since 2020, he has been appointed as the Chief of the Lower Secondary Education and has been working to implement the inclusion of rabies into the curriculum, into the teaching curriculum of primary and lower secondary schools in Lao PDR. Presentation, please.
Good afternoon, ladies and gentlemen. I would like to briefly present about integrating rabies education into school curriculum of primary and lower secondary school. There are three topics: rabies situation in Laos, rationale to integrate rabies education into school curriculum, process of implementation. For rabies situation in Laos, rabies is one of the 5 zoonosis priority by two ministries, Ministry of Health and Ministry of Agriculture in Laos PDR. Human rabies death is reported every year, but grossly under-reported. Rabies situation in Laos. The Ministry of Health and Ministry of Agriculture jointly organized the national stakeholder meeting to develop a national strategic plan for control and prevention of rabies in Laos PDR 2020 to 2024 on 17 to 18 October 2019 in Vientiane. The meeting was participated by 3 ministries: Ministry of Health, Ministry of Agriculture and Forestry, and Ministry of Education, and Defense, 3 Reduction Agriculture, WHO, OIE-WHO, and the Global Alliance for Rabies Control. In 2020, the nation's strategic plan was endorsed and jointly published by the two ministers. The reason the we integrate rabies into teaching curriculum are because globally 40% of rabies victims are children younger than 50 years. In Laopedia, report dog bit include both children and adults. Integrate of rabies education into school curriculum was one of priority activity identified in the National Rabies Strategic Plan to prevent the two rabies by making children fully aware of rabies, educating children on how to prevent dog bite, educate children on what to do if bitten by a dog. 2020, July, the first meeting, determine target grade in primary and lower secondary school. Identify IEC material to be used, poster and flipbook. Discuss outline of lesson to be integrated. Determine area school to pilot, Sayabuli. 2020, August, the second meeting to develop control of rabies lesson and poster and flipbook. 2020, September, the third meeting, finalization, poster and flipbook. Transmission cycle, symptom of infected rabies in human and dog. Management after dog bite. Prevention from dog bite. Develop a program for training of school principal and teacher. 23rd to 26 September 2020. Training of school principal and teacher in selected area. External and dog with children before integrate rabies lesson in select school. Way forward in 2021. Monitoring visit during the period. Evaluation knowledge and number of report dog bite and rabies case after 1 year of implementation. Expansion to other district and province.
Okay, so thank you, Mr. Vatsana, for your presentation from Laopedia. So that ends all the 4 presentations for this session. And as you all know, this session is mainly focused on risk communication as to how countries have used effective risk communication to reduce or to eliminate, preventable human deaths from dog-mediated rabies. And we can see that there are good examples from India, from Goa State, from Bangladesh, and also from Laopedia. And similarly, I think there will be several similar kind of stories from around this region as also around the world. So there are several questions being posted on the chat box by different topics, and I can see that some of them have been already answered by our colleagues from Tripartite, also by the speakers. However, just for Dr. Murugan, since you are, I think that there are a lot of questions posed to you. So I'd just like to summarize some key issues that has been actually voiced out here is that although like in the Goa state, it seems that you have done a great job, that you have been able to spread the message and also bring down the incidence of the human cases to zero level, and also on the path to elimination using the education and all. For overall for India, since India is a subcontinent, it's like a big subcontinent. So what do you think is the outlook to change the system? I mean, to bring about a behavioral change amongst the policymakers and also amongst the important stakeholders to to bring about more awareness and education in India. Yes,
Yes.
Dr. Murugan.
Yeah.
Very short.
Yeah. Do you hear me? Yeah.
Yes,
Yeah. We
yes.
have experimented. This education plays a major role. Of course, it takes time, and so state by state, taking this education followed by the mass vaccination is going to make a fantastic result. That's what we have found in Goa as a model for the last 6-7 years. So education in the beginning to start with, then followed by the vaccination is going to make a big impact actually. And during the vaccination as well, the people with education should support the vaccination to increase the number of vaccinations, to manage the compliance and the rejections. So that is going hand in hand with education. So education is playing a key role in this program. So in the Goa state, presently the Goa state, the control of this rabies could be extended to the nearby states like Maharashtra and Karnataka. That is the next target maybe. So that already protected Goa state is going to be intact, and the other states, the neighboring states, could be made rabies free in the next phases. So that's a key point, and we are trying to convince the neighboring states as well to take up the education and the vaccination projects by this infrastructure which is available with the states. Yeah.
Thank you so much for your clarification. Because of limited time, I just have one query about the use of oral rabies vaccines in Goa state, and whether or not you're going to whether or not oral rabies vaccine has been used to complement or supplement the parenteral vaccination in dogs. So maybe either you, or maybe if you are not, are you? Can you clarify on this one, or
Yeah.
Dr.
I
Murugan?
tell you what we have done. And so we have taken trials of the oral vaccinations in the places where we are not able to reach, for example, the forest areas and this interior rural areas. We could not reach with the neck catching and hand catching technology. So in those places, we have taken trials of oral vaccinations, and it is a good successful. Really, it is indeed a very good support, but we are waiting for the government sanction, because this needs to be sanctioned by the government of India for taking the actual the procedure of the oral vaccinations. So we are looking forward for that. The trial is successful, and we are able to, we are able to cover more of the hidden animals in the forest areas and the interior areas through this technology. Thank you.
Okay. Okay, so thank you so much. I think owing to the lack of time, we are not able to, cover all the questions here. However, I can see that many of the questions have been already answered in chat box. So please follow the chat box there. Now, that is the end of this session, first session on the risk communication and all. So now I would like to hand over for the next session to Dr. Katinka Dibalo from FAO-OIE in Bangkok, and she will be the moderator, and she will take over this second session on rabies surveillance and strategic dog vaccination. Over to you, Dr. Katinka.
Thank you very much, Dr. Kinzang, and good afternoon to all the participants. I see we have 188 participants, so this is really, really a great turnout. And actually this morning we were already celebrating or commemorating World Rabies Day here in Thailand. There was a major event with the Thai government, and it was very good to see the high turnout. So I'm very pleased to introduce to you the second session today, and we will be looking more on rabies surveillance and strategic dog vaccination. I will be moderating this together with my colleague Sophie Hurif, who is here with me. So hi, Sophie. And we will be looking first of all on surveillance, and we have a presentation on this, and then we will have some country experiences, and these will be coming from Bhutan, Nepal, as well as Myanmar. So let me first of all introduce our first speaker. It is Dr. Islor, and Dr. Islor is an associate professor and laboratory director of the Rabies Diagnostic Laboratory in Bangalore in India. Dr. Islor has been working in the fields of veterinary microbiology for over 29 years and has been involved in diagnostics and vaccine development, as well as molecular epidemiology and training in rabies. His laboratory has been part of the OIE lab twinning between his lab in Bangalore and the CDC lab in Atlanta. Dr. Islor received several awards, including the National Level Visionary Award for the Outstanding Achievements in Rabies by the Indian Veterinary Association. And he has also been resource person in several of the tripartite events, including the SARC meeting in Nepal. So most recently, Dr. Islor was nominated as the member of the National Technical Advisory Committee of the Ministry of Health of the Government of India for the control and elimination of rabies in India by 2030. And he's involved in the preparation of the draft National Action Plan for Rabies Elimination. He will be presenting us on how to upscale dog rabies surveillance. So over to you, Dr. Islor. Thank you.
Hi all. Improving the disease surveillance mechanism in case of animal husbandry sector is actually the basis for evolving various kinds of strategies for the control of such diseases. And hence, this particular presentation on how to upscale dog rabies surveillance. Well, why do we need to upscale the dog rabies surveillance? You know, dogs actually act as the major vectors in transmission of rabies, and it is necessary to know the precise occurrence of rabies in different geographical locations in the region. And of late, even in our laboratory, we have been documenting increasing number of the cases of rabies in livestock with a special reference to cattle and buffalo. So it is necessary to evaluate the rabies control program before the implementation as well as after the implementation. Well, the prerequisite for upscaling the rabies surveillance is to strengthen the laboratory infrastructures. So in this context, our KVFSU, CVA, and then Crucial's Rabies Diagnostic Laboratory was actually established in the 2013 at our veterinary college in Bangalore. Since then, we have been conducting the series of training programs for the veterinarians from different veterinary institutions in the country, as well as the veterinarians who are actually working in the field. And here we have two kinds of surveillance mechanisms. One is for the surveillance of the virus, the rabies virus, through preliminary screening of the brain tissues collected at the field level by employing the immunochromatographic technique, that is lateral flow assay. Then the samples are actually submitted to our laboratory where we employ the monoclonal antibody-based direct fluorescent antibody assay. And primarily for training purposes and for selective samples, we are employing direct rapid immunohistochemistry test. Then we are also into the molecular epidemiology of the rabies viruses, which are lurking in different locations in the country. Then as far as the sero surveillance is concerned, routinely we are employing a rapid fluorescent focus inhibition test, RFFIT, which is employed especially for international movement of pet animals. And we are also into the process of development of recombinant G protein based ELISA. And this is actually very feasible, and ELISA can be done in most of the laboratories where the biosafety measures are not necessary. Well, for this, submission of quality brain samples from the field, from the suspected cases of rabid animals is also very important. And then availability of user-friendly, robust diagnostics is also important. Here, training of veterinarians in the urban as well as the rural areas on the usage of a user-friendly method of brain sample collection, that is occipital foramen method. You see the conventional method of brain sample collection through opening the skull cap. It is already there since last say several decades, but the field veterinarians are not very comfortable employing this skull cap open method. We also train them on how exactly to pack the brain stem once it is collected, and then how to submit it in 3 different tier system. Yes, some of the veterinarians who do not have the privilege to undergo training program in our laboratory, whenever they contact us over phone, then we turn on to the WhatsApp video approach. We just, as you can just very clearly see in this picture, we just try to enlighten them about the WhatsApp video based approach for brain sample collection. Then we can also, sitting in Bangalore in our laboratory itself, we can very clearly see the brain stem being collected. Then yet another limitations is convincing the courier services for shipping the brain samples. But sometimes it's very hard to convince the courier persons, because this is actually animal tissue. They think several twice to whether to accept it for shipping it to our laboratory or not. So it is very important to convince the courier services for shipping the brain samples to our lab or to the nearest laboratory wherever it is feasible. Then, you know, we have been employing these quality diagnostics, but they are relatively more expensive and may not be affordable. So it is necessary that we have to develop the cost-effective, quality, indigenously developed, and most importantly, user-friendly diagnostics. So in this context, we have actually experienced that the quality lateral flow assay could be employed as a preliminary test just by the side of the carcass itself, and then the brain sample will have to be shipped to our laboratory, irrespective of whether this particular, say, brain sample is actually LFA positive or negative. With all these, the dog rabies surveillance scaled up in India under the OIE training program on strengthening of diagnosis of rabies in India. This is where we are put up and then twinned under OIE training program with APH as well as CDC Atlanta. So with this rigorous training program, so we have established a very good network of rabies diagnostic facilities, and then as a part of this OIE training program, series of training programs have been conducted since the last 7 years, and this is our team. On being invited by different veterinary universities in India, and then we conduct a training program for the localites. We just would like to assess the impact of such training programs. We can very well appreciate that our field veterinarians are finding it very comfortable. They are finding this occipital foramen based brain sample collection. They find it very user friendly, and that's how the inflow of brain tissue samples is also increased. So thereby we have a robust dog rabies surveillance mechanism. Yeah, as I said, we have improved surveillance of rabies in dogs since the last 7 years. Here we can see the annual trend of occurrence of rabies in case of dogs. So gradually there is increasing trend, and that here we can see the cumulative occurrence of rabies in case of dogs. This is the annual trend, and so far we have tested about say some 1093 brain samples from only dogs, and then out of this about say 745 brain samples were found to be positive. That amounts to about say 75% of the brain samples that we process from dogs, which have been suspected for the cases of rabies, were found to be very clearly positive. That nowadays we are documenting more and more number of cases of rabies in cattle as well as buffaloes, and this is directly going to affect the economy of the livestock owner or the poor farmer in the villages. In the recent past, we have actually tested some 100 plus brain samples from cattle as well as buffaloes, and we find that nearly 85% of the brain samples were found to be positive for rabies viral inclusions. This is one alarming situation. This is one of our major concerns. Yet another aspect, avail the expertise of veterinarians having masters or PhDs in animal rabies itself, those who are working in the veterinary hospitals or in the field. This is what precisely we are actually cashing on. They are our strength, and they may be working in the veterinary hospitals or in the field. We have to encourage the ground level warriors. You see, it is necessary that we have to conduct say the sessions on motivation for all the concerned, including the frontline warriors. You know, nowadays the COVID-19 has totally eclipsed almost all the infectious diseases in case of human beings. And you know how well the warriors, all the ground level workers have been actually respected. And likewise, another issue is, instead of using the terminology dog catchers, why not we refer them as human animal handlers? Here you can see they are all the field level warriors. Here they are very, very important chunk of this system. Then another important issue is make the community realize its role. See, control or upscaling the surveillance of rabies is not just the job of a veterinarian or any other stakeholder. Community is also equally important. Make the community realize what they are supposed to do. Say, as a part of this, recently in some of the places, the zero rabies helpline has been established. So also in Bangalore, then they have also created a separate isolation facility for rabies suspected dogs. As a part of this zero rabies helpline, the general public needs to be educated so that in case they come across any rabies suspected dog, which could be again biting dog, they can immediately contact the concerned at this zero rabies helpline, and then the team from this helpline will rush to this spot, and then they will actually catch the dogs, and then that will be isolated for further observation. Then involving celebrities for improving rabies surveillance. You know, celebrities are very, very popular among the general public or community. At times, the general public may not really listen to what we, the technocrats, say. With all these inputs, important to find out the source of funding for improving the dog rabies surveillance. You see, there are various kinds of government programs on disease control, and some of these disease control programs do have provisions for funding towards rabies surveillance program and then control program. Then there are various intramural as well as extramural funding sources in different countries for animal disease research related programs. Then we can have the funding from the civic bodies, the municipal corporations, the municipalities, or the panchayati system existing in the village levels. Then corporate sectors. Corporate sectors are actually have a major mandate of corporate social responsibility for the corporates that can really bring a kind of change in the lives of the people. Then another issue is revolving fund. So what we can do is some nominal charges can be made towards the brain sample processing. And then if some particular laboratory is involved in virus neutralization test or a RIFIT or FAVN for the purpose of international movement of the pet animals, they can also definitely charge for that. With all these technical inputs, upscaling of dog rabies surveillance has been prioritized under the National Action Plan for Rabies Elimination. So here what we are actually proposing is, in the block level, the trained veterinarian can collect the brain tissues. Then he or she will have to be properly trained on how to pack it and then how to ship it to the nearest district level laboratories, where the preliminary screening could be done using the lateral flow assay, and then such say brain tissues which have been tested in the district level laboratories, they will have to be further transported to the state level laboratories, where the DFA will have to be strictly done, and then DIRIT, depending on the availability of DIRIT and then PCR facilities. Once the confirmatory diagnosis is done at the state level, for further molecular characterization, if necessary, these samples may be shipped to the regional level laboratories. The samples can also be submitted to the national reference laboratory for further analysis of the samples as well as for analysis of the data that were generated, and then for final documentation. Once all this is done, the national reference laboratory is going to transmit this information to the Department of Animal Husbandry and Dairying, Government of India. Recent designation of our laboratory as OIE reference laboratory for rabies is a major milestone in the region. And one of the important mandates is improving surveillance of rabies in animals. And this is where we are actually located. And in fact, this is the 12th OIE reference laboratory for rabies. Here we are actually expected to provide the technical inputs as well as the scientific excellence to these South Asian as well as Southeast Asian region. And as a part of this, in association with OIE, we are actually planning for a virtual training series on rabies diagnosis for SARC region on 5th and the 6th November 2020, so that we can have a harmonized approach as far as the rabies surveillance in case of dogs is concerned. With all this, finally to conclude on this occasion of World Rabies Day 2020, wherein we are actually observing the death anniversary of the great scientist Louis Pasteur. Salutations to him, and let all of us join together. Let us stay strong with an attitude of never give up to end rabies through effective collaboration among the stakeholders, and then through vaccination. And this is my proud team. And with all this, I thank the University KVFSU, the CVA, NCDC, DAHD, OIE, WHO, and FAO. Thank you so much.
Oh, thank you so much, Dr. Islor, for a very inspiring presentation on how to upscale dog rabies surveillance. It is a good idea to involve the celebrities, or nowadays we recognize a social media influencer, to approach the young generation awareness on rabies. Move to next presenter is Dr. Karma Wangdi. He's currently the Chief Veterinary Officer at Department of Livestock, Ministry of Agriculture and Forest, Thimphu, Bhutan. So Dr. Wangdi started his career as a young vet in 2010, and since then he has a good working experience as field veterinarian, organization management, and poultry expertise. He has conducted a number of rabies outbreak investigation and control program in the field. He has also contributed in developing a number of strategies to prevent and control animal diseases, including rabies elimination by 2030. And now he is also the National Project Coordinator of Bhutan Rabies TCP, funded by FAO, for capacity and response plan to eliminate rabies by 2030 in Bhutan. He is also actively involved in the implementation of dog population management program as technical working committee. So he will be presenting a Bhutan experience on using rabies surveillance for strategic dog vaccination. Yeah, the presentation, please.
Hello everyone, Kuzambo from Bhutan. On behalf of Department of Livestock, Ministry of Agriculture and Forest, Royal Government of Bhutan, I'll be sharing experiences of Bhutan on using rabies surveillance for strategic dog vaccination, issues and challenges faced during the time of surveillance. So basically, I'll touch on the following key topics during my presentation. Just to highlight briefly on the rabies epidemiology in Bhutan. Endemic rabies cases have been recorded in eastern and then southern part of Bhutan, which shares border with India. And then, of course, there are some sporadic cases of rabies being reported from interior parts of Bhutan in the past. And of course, the primary livestock species affected are cattle and dogs. And the rabies that has been recorded in Bhutan are all dog mediated. And if you look at the virus that has been isolated, it is closely related with the Indian strains and the South Asian Arctic-like wine viruses. And of course, rabies case have been reported around the year in Bhutan. And if you look at the temporal distribution of rabies over the last 1.5 decade, the highest cases of rabies has been recorded in 2005, 6, 7. And then since then, the rabies cases in Bhutan has been on decline. And since 2016, so there is no human rabies cases being reported in Bhutan. And on an average, there are like almost 7,000 dog bite cases annually, which accounts to nearly like 1,026 bites per 10,000 people. And if you look at the average, annual average dog bite cases, Paro district recorded the highest cases of dog bite, followed by Sarbong, Chuga, and so on. And if you look at the over the last 10 years data or record, the highest number of human rabies death has been recorded in the year 2011. And coming to rabies surveillance in Bhutan, so basically we tried to go through the by using three-pronged approach. The first one is based on the clinical signs and symptoms. The second one is surveillance, passive and active surveillance in wildlife. And then finally, the third one is the laboratory diagnosis that is done through rapid tests as well as to the confirmatory trace. Coming to the rabies surveillance and then reporting system in Bhutan. So with the blessings and guiding from the Ministry of Agriculture and Forests, we have at a national level, we have a National Center for Animal Health, which is basically the national referral lab for all the livestock diseases. So the National Center for Animal Health, they plan the National Surveillance Action Plan. And then this plan is further cascaded down to the Regional Livestock Development Center, which is divided into 4 regions in Bhutan. And then further this RLDC, they try to facilitate the districts in carrying out the surveillance, and then further cascading down to the sub-district and then to the farmers. And the reporting system starts from the farmer. The moment they observe there are some suspected cases of the dogs biting cows or other livestock species rampantly, then they try to report to the nearby livestock action center, which then relay the message or information to the district veterinary hospital, where do they collect the samples or they try to do some rapid diagnosis tests, and then they further forward the sample to RLDCs and then to the National Center for Animal Health for the final confirmatory test. And then of course this surveillance and reporting are all done in close collaboration with our Nature Conservation Division under Department of Forest and Park Services. And then we also have our National Veterinary Hospital and then City Veterinary Hospital, which also complements during the time of rabies surveillance, especially along the border. And then of course, we have an online system like VIS, Veterinary Information System, TAT-Info, WAHIS. And then of course, we publish rabies outbreak data in our annual status report, which is then further shared with our OIE, our counterpart at OIE through a WAHI system. Now coming to dog vaccination strategy. So based on the surveillance result, then we go for the vaccination. So this vaccination is basically categorized into 3 approaches. The first one is the responsive vaccination when there are outbreaks. So we go there and vaccinate the dogs. The second one is mass vaccination campaign. So basically this is based on the surveillance result by identifying the high, low, and medium risk areas. So we go for mass vaccination, especially in the high risk or high prone areas. And then the third one is a regular pet dog vaccination. Now, as I have already mentioned, so we try to identify the risk zones and then map based on the past surveillance records and then dog population dynamics. And depending upon these risk zones, the high risk, low risk, or medium risk, then we go for a nationwide vaccination program, which is planned and then go implement it annually. And then of course, we also try to go for mass vaccination, especially that is a focused approach or prioritized based on the recent outbreaks in areas where there are frequent outbreak of rabies. And so during this vaccination, so at least we try to cover 70% of vaccination. So if you look at the incursion or spread of virus, so usually you can see all the viruses or the entry or the spread of rabies is along the border, which we have a porous border or maybe associated with the movement of people. And if you look at the stats and facts and figure, usually the capital city like Thimphu have highest number of vaccination coverage. Basically, this is due to the more number of people owning pet dogs and as well as an enhanced dog population management program, which we do it through cash, neuter, vaccinate, and release program. And then of course, the vaccination coverage is also high, especially in the endemic areas where we try to go for a focused approach to control the outbreak. So we do vaccination quite frequently there. And over the last 1 year, so Bhutan recorded like almost 68 cases of rabies outbreak. And then we have also achieved like almost, if you look at the vaccination coverage, especially places like Thimphu, the capital city, where there are more number of pet dogs, and then especially in the endemic areas where there are more frequent outbreak of rabies. So there we have achieved the higher percentage of vaccination coverage. Now, coming to issues and challenges, of course, there are many issues and challenges during the time of implementation of surveillance program. The first one is the lack of resources, that is committed human and financial resources. So in order to have a sustainable and then consistent surveillance for the rabies elimination, I think this committed human and financial resources is very important. The another one is catching difficulty, especially when we go for vaccination. So to catch stray dogs, I think is quite difficult. So thereby it also affects the vaccination coverage. And of course, like when we go for mass vaccination campaigns, so I think to garner a public support is also very important. But because of social stigmas and sentiments, I think it's very difficult to garner public support, which also affects in identifying or locating stray dogs and catching the stray dogs. That also affects the vaccination coverage. And of course, the fourth one is poor cross-border coordination and information sharing. So here, when there are outbreaks or rabies cases in India, so if the information, the real-time information is not shared with us, so by the time the outbreak or the rabies spread to the Bhutan side, then it becomes too late for us to, activate our response plan. So thereby it also affects the overall control or the rabies prevention control plan. And then of course the transboundary movement of free roaming dogs, I think is quite difficult or challenging given the porous border and the free movement of people. So I think it's also very difficult to control the movement of dogs from one place to another. And then of course inadequate capacity in terms of human as well as the diagnostic capacity. So this is basically when at the time of disease surveillance, so we need qualified people to do surveillance or do sampling collection or whatever it may be. And of course a diagnosis facility to provide a timely prevention and control plan in the field. And then finally coming to acknowledgement. So I'd like to, on behalf of Department of Livestock, so I'd like to thank the Ministry of Agriculture and Forest, Royal Government of Bhutan for providing us with the timely policy directives and support in ensuring or giving us a clear directives how to go about in control of rabies in Bhutan. And then of course, Ministry of Health under a One Health approach. So we have a very strong collaboration at the time of disease outbreak and response in the field. And then of course, I'd like to also convey our sincere thanks to international organizations like OIE-WHO and then FAO for ensuring a timely technical support as well as a financial resources in controlling dog-mediated human rabies case by 2030. And it won't be fair on my part also if I don't acknowledge Dr. Tenzin, who has been the backbone and has played a very instrumental role in rabies control in Bhutan. Thank you and Tashtele.
Thank you very much, Dr. Karma, for your presentation and sharing the experience of Bhutan in rabies prevention and control, and especially your challenges that you are facing. I think many countries are facing very similar challenges, and I think this is also a good part for the discussion. I see there are already some questions for you in the chat as well. Thank you, Dr. Islor. You also already, I see that you're providing some responses. So I would like to introduce our next speaker, who will be sharing the country experience from Nepal. And this is Dr. Sharma, who I've seen you giving many presentations lately, Dr. Sharma, in various topics. I think last week you were on limpy skin disease and now on rabies. Just to give an introduction, you have a very impressive curriculum, and Dr. Sharma is currently the Director General of the Department of Livestock Services of Nepal, and he has had many other important positions. Just to mention, he obtained his Bachelor of Veterinary Science and Animal Husbandry from Orissa University in India, and he holds 2 master degrees. And it's interesting, one in public administration and the other one on molecular biology from Belgium. I always like to see the languages, and I see you have very excellent English and Nepali, but also Hindi, French, and Oriya. So, Dr. Sharma, over to you for your presentation, please.
Thank you, Katinga.
Can you please share your screen?
Yeah, yes. Okay.
Okay.
Are you listening?
Yes, it's coming and we can hear you clearly. Over to you. Thank you.
Thank you very much. I'm going to present Nepal experience on rabies surveillance on strategic dog vaccination issues and challenges. And as we all know that today is the World Rabies Day, and we celebrate it in Nepal also. And in rabies, collaborate and vaccinate. This is the main, and we do have a Nepalese version for this one also. Okay, so I'm giving the outline of my presentation in this format. This is the map of Nepal, and we do have a 7 province. Currently, Nepal is under the federal system. Previously, we have a centralized government systems. Now we have a federal system, and it makes a little bit difficulty in also reporting systems at the moment. But we are carrying our best how to tackle with this. And the map, just I'm showing you that we do have a very clear cut of the population statistics of cattle, buffalo, goat, sheep, pig, but we don't have a, there's a population of the dog. This is a quite important thing, but now we are trying to do this in our next census. Though we know that's about 60,000 deaths per year worldwide due to the rabies, and 2/3 of the countries in the world are affected, and 45% of global burden of human rabies is in our SARC region. Children of 5 to 15 years age represent 40% of human rabies death. 90% of the rabies cases linked to rabies infected dog bite, and in Nepal also the situation is the same. 1 death in every 9 minutes by rabies, and 100% fatal, but 100% vaccine preventable also. Rabies is endemic in Nepal. Right now also there are some cases of rabies in different districts of Nepal, and we have a 2 cycle in Nepal. There's urban and selvatic. Urban in the urban area, and selvatic in the region nearby the jungle and forest area. And we do have a animal death of more than 150 annually. That is from the 2019 report. Rabies is a serious public health concern in Nepal. I'm going to show you the distribution of the rabies in Nepal, and the temporable distribution also. January you can see, and there is a peak in the January. We do have a lot of number of affected cases. That is from 2016 to 2019. And in the background also we can see dog, cat, and jackal, while this is the selvatic cycle, and other one is the urban cycle. Next. And I'm also showing you that 2016 to 2020 with more than 10 outbreak of animal rabies in this highlights. This is the eastern part of Nepal. This is the somewhere central part of Nepal, and still this year also we have a outbreak over here, and we are trying our best to vaccinate the dog and counting the dog in this area. And this is the nearby Kathmandu Valley. This is also one of the hottest spot, and this is one also hottest spot, 2 districts and here. And these are the place where we have more than 10 outbreaks from 2016 to 2019. In year-wise distribution and species affected, we have showing in this graph. And the cattle is the major, cattle and dog. 36% of dog affected, 33% cattle out of the infected by rabies, and 13% is the goat, and the buffalo 16%. So this is the case. And these are the graphs where we have shown 16, 17, 18, and 19. Just we have shown how much infected by the rabies. Next. Nepal is producing tissue culture rabies vaccine in Nepal, and we are doing this one from 1 decade. And at present, we have a production of 150,000 doses of vaccines per annum, and we are trying to make it up to the 1 million by 3 years period of time. And this, you can see, this one is the production in Nepal, and this we imported from outside. What we thought that if we can produce the 1 million, we can have a full complete immunization program in our country by our own vaccine. Uh, and I'm also summarize the rabies human health sector update also. 1780, we do have a data of that's 32 human death and 281,718 anti-rabies vaccine consumed. And in the animals, or the animal bite there 477, whereas there is a dog bite of 33,204 by 1718, and we do have a similar patterns from 2008-9 onwards. And then 2019, household sector has launched national guidelines. Women health sector has launched national guideline for rabies PEP, and since May 2019, the government of Nepal has prioritized intradermal rabies vaccination program in women in order to minimize the cost of completion of full course of vaccination. One health strategy framework is in place. One health action plan is in preparing stage in Nepal. One of the major things what we did last year is the SHARI assessment, stepwise approach towards rabies elimination. We do have a support from the different donors and the rabies global rabies network also. And then we have data collection and analysis, total 22 activities. 13 activities are pending and 9 accomplished, like prevention and control, 6 accomplished and 20 pending. Laboratory diagnosis 5 accomplished, 8 pending. Dog population related 11 is pending and 1 accomplished. Information education and 14 pending, 5 accomplished. Cross-cutting issues 7 pending and 4 accomplished. And legislation 5 pending and 7 we have accomplished. And one more thing is that rabies is notifiable. From last year, it's more than 6 months back. This now the rabies is the notifiable disease in Nepal. It is already published in the Gazette. Rabies control activities in the country. Vaccine bank is established. Actually, we do have a vaccine bank in the National Vaccine Production Laboratory in the central and the regional veterinary laboratories in the province. So we have a 5 province lab where we put the rabies vaccine for emergency use, and in the central National Vaccine Production Lab we put. Outbreak response is there, and mobilization of vaccine we are doing. And in this year rabies day, we have given around 25,000 doses of rabies vaccine to the municipality, sub-municipality, and rural municipality of the country, along with the province and central government offices. And there is mobilization of vaccine from the province lab and from the central. Education and communication also there. School education system is also there. Rabies as a notifiable disease by law in 2019, as I already mentioned. Case definition of rabies in place in both human and animal health sector. Recently, we have done this one also. Awareness through World Rabies Day. This morning also I have given one lecture even in the national television, and it's a quite a popular program. And a free dog vaccination program is going on and continuous. And there is a good participation from the local level government in this regards. Rabies control strategy we are drafting, and we are also preparing a strategy action plan. We do have a TCP support from the FAO on this regards. and we are working on this one also. Vaccine production capacity enhancement. So we are trying to go up to the 1 million doses by next 3 years. And the laboratory strengthening is going on, and the facility of the lab is strengthened. Quality control of vaccine production is also going on, and laboratory strengthening is as usual. Rapid rabies, and in the diagnostic part, rapid rabies antigen detection test, negri body test, as you have done, and fluorescent antibody test, mouse inoculation test. These are the different tests we used to do in our central veterinary laboratory in Nepal, and also province lab also we are trying to do this thing. And gap and challenges, I would like to narrate you some of the things. Concrete legal framework and action plan. And this we are missing, but we are trying our best with the TCP from FAO also focusing on this. And hopefully by next year, we will have these things solved. And dog sensors. This is not that big issue, but still, it's neglected. State dog, community dog, and all the dogs, the population is neglected. And we have put in our national sensor that is going to be held next year. So by that one, we are trying to get this one very properly, and it may help. A shared responsible and sustainable budget. This is quite important. The rabies vaccine doesn't cost much, but majority of the people and places, they ask for the free. And to supply all the free every time is not that sustainable for the government. This is the problem. But anyway, we are trying to solve this one with the participation from all sectors and stakeholders. And there is also vaccination to the whole population, animal breed controls, controlling and neutralizing, and this is important. And there's also roadways disposable of waste also. That's a quite important. Otherwise, the population of dog increases due to the waste food in the roadways. This is also important. And cleaning of the areas is quite important. And then also integrated bite case management, that's also quite important. How to take care, this is also important. There is some gaps. And federal context, as I've already mentioned, 753 municipalities are there, and they are working on their own, and we have to cooperate them in a technical backstopping to each and every one. And that is a challenge for the central government at present context. And public-private partnership, we do have some NGO, INGOs, and other organizations, social organizations, they are cooperating on this one. But when there is a lot of problem, then government should go, and PPE is a little bit not functioning in the rural and remote area where there is a dire need of these things. So I'm going to conclusion and recommendation. Dog population survey is quite important, and this is our priority also. Real burden of rabies need to be assessed. Actually, this is also important part to do, and we think we should do this one very soon. Approval of national rabies control strategy. We are in the process of making it with the help of TCP, FAO, and then after we'll approve from the government. A functional technical coordination committee from the human health, animal health, and also from the municipality. So we need this type of technical committee to have better understanding of the thing. Responsible dog ownership. This is also important in the urban area. I'm telling whenever there is a dog is in a good shape and everything is good, then they will keep it. And when there is a little bit problem, that is go to the street, and that makes a problem, and there is no ownership. So maybe tagging of the dogs and have a ownership, and maybe certificates, and these things also, that's important for the urban area, and we have to do this also. Birth control program, this I've already mentioned, and this is also quite important. And what's the population of dog we need in our city or in the village, so we have to manage accordingly, so that it's easy to work on this one. And nationwide mass dog vaccination is important, and we are in this path. Solid waste management for habitat control of free roaming dogs, particularly in public place, hospitals, school, and marketplaces, is quite important. They are mingling each and everywhere, and we should control for that one. And if there is a less waste feed, so there is a less dog population in that area. Individual capacity for surveillance, diagnosis, prevention, and control of canine rabies should be built up at all levels. So that's important thing. And at present, we are taking all the data and systems from the epidemiology surveillance from the 753 municipality, and we are making the backstopping to them, how to report and all these things, and it is working very slowly. And there is a shared responsibility and investment by wildlife, environment, human health, and animal health sector at all levels, local, provincial, and federal. And improved surveillance is needed to reduce uncertainty in burden, estimate, and to monitor the impacts of control and effect. Anti-rabies vaccination more than 70% that's needed, and political commitment. Though there is a commitment, but still it's not that level. Each and every province, state, everywhere there should be political commit so that we can control very perfectly the disease. Coordination and partnership almost by various ministries, that's important. Intersectoral coordination mechanisms should be established at federal, provincial, and local level for implementation of rabies control program, education, and communication. And in this regard also, rabies is much more neglected now due to the corona pandemic. Coronavirus pandemic is a huge issue, and everybody is thinking about that, and nobody is thinking actually. Department of Livestock is much more about this rabies eradication and all things, and so more resource and more thinking is going to the corona, and it also hindering a little bit in our progress. Finally, I will acknowledge Dr. Dikar Dev Bhatta, Chief Central Veterinary Laboratory, Dr. Umesh Dal, Chief National Vaccine Production Laboratory, and Dr. Mukul Upayat, the Senior Veterinary Officer, Veterinary Epidemiology Section, for providing me the inputs and the things which I presented on before. And finally, I would like to thank OIE, FAO, WHO, and all the participants for listening for this program. Thank you. Thank you very much. Next.
Thank you very much, Dr. Sharma, for sharing the experience of Nepal. And my congratulations, especially for making rabies a notifiable disease. I think this has been huge progress that has now been made in recognizing rabies as a notifiable disease. I can see that having urban and sylvatic rabies is quite a challenge. And I already see there are quite a few questions in the chat already also for you coming along. So without further ado, I would like to pass it to introduce the last speaker of this second session. And this is from Myanmar. We will be listening to mass dog vaccination experiences from Myanmar. This will be a double presentation. So initially it will be Dr. Min Tien Mao, the Director of Veterinary Medicine and Disease Control Division of the Livestock Breeding and Veterinary Department of the Ministry of Agriculture, Livestock and Irrigation from Myanmar. He completed his PhD in 2009 from the Department of Veterinary Microbiology from Gifu University in Japan. And he's also responsible for veterinary medicine and controlling animal diseases, including rabies, as well as the OIE focal point. So he has a special interest in dog rabies vaccination, as well as working towards zero rabies 2030 in Myanmar under the One Health collaboration. So this presentation will be together with Dr. Marina Ivanova, and my colleague Sophie will introduce her. Sophie?
Thank you, Katinka. So along with Dr. Min Tien Mao, Dr. Marina Ivanova will be also presenting the experience from Myanmar on mass dog vaccination. So Dr. Marina Ivanova is a senior project manager at 4PAWS International. She graduated at the veterinary faculty in Bulgaria, and since 2004, she works for 4PAWS, appointed as a team leader in 2005 for the International Stray Animal Care Project. Dr. Ivanova has taken part in many international missions. She was in Sri Lanka after the tsunami floods, and in Philippines also after the Typhoon Haiyan, and also she was part of the mission in Serbia and Bosnia after the deadly floods in 2014. While in the same year, a 4-pod team led by her also worked on the territories of 2 of the most seriously affected by the floods location in Bulgaria. Since August 2016, she's leading the anti-rabies program of the organization in Myanmar. And in September 2020, she moved to work at 4-Post headquarters in Vienna as a senior project manager of the project development department, where she will be responsible for different rescue mission and project worldwide. Please, the presentation.
Hello, everyone. Good morning, good evening. My name is Mendemo from Myanmar. Before my presentation, I would like to express my sincere thanks to OIE for inviting to share mass dog vaccination experience from Myanmar to this special occasion commemorating World Rabies Day 2020 through this virtual webinar. My presentation is divided into 2 parts. I'm going to present first parts by me, and hopefully second parts will be presented by the representative from the FAO International. So this slide show the contents of my presentation. It will include vision and mission, rabies situation, rabies initiative, mass dog vaccination pilot project, national plan, our achievement, and finally our way forward for the joint project of rabies-free Myanmar between LBBD and FAO International. So our vision is zero rabies fatality in human and animal population by 2030. For achieving our vision, we use a mission of 90% reduction rabies beyond 2080 and zero rabies in 2030 using stepwise approach as shown in here. We are in between the stage 2 and 3, that is, national plan has been developed and the mass dog vaccination campaign in pilot area are conducting and rabies risk reduction through the full-scale implementation of the control. So this slide shows the rabies situation in Myanmar. There are about 6 million dogs are estimated, and more than 70% are stray. So annual human rabies cases were around about 200. Annual dog bite cases are around 20 to 60,000 per year. So the dog transmitted rabies is major cases in all scenario. So as you can see here in right upper right, the rabies cases figure is there, and in right below is the canine rabies cases, which is confirmed by the laboratory. Our rabies initiative began with OIE support, providing donation of 200,000 doses of rabies vaccine in 2013. In this slide, Dr. Ronaldo Abella from the OIE sub-regional representative is handing over the rabies vaccine to LBBD in 2013. And this slide shows the contribution of the OIE International Organization to Myanmar. In here, from 2013 to 2015, the OIE provided the total of 400,000 doses of rabies vaccine to Myanmar. From 2018 onward, FAO International, one of the potential partner organizations, donated a total of the 450,000 doses rabies vaccine to Myanmar, which are the parts of our 1 million dose campaign for our rabies elimination in Myanmar. Our campaign was supported by the OIE created a project that allowed piloting mass dog vaccination campaign in 3 pilot townships of Lewe, Nyao, and Mobi Township between 2016 to 2018 and developing a national plan in Myanmar. As an initiative, we began with pilot area with strategically key facts about our campaigns are the risk-based approach, strategic planning, procurement in timely manner, vaccinator training, pre-exposure prophylaxis, vaccinator guideline, and SOP development, and daily recording and reporting. And we emphasize on the more than 70% coverage at targeted township area and with less than 50 working days per target area. And this slide shows that we have developed Myanmar National Plan for Rabies Elimination and Dog in 2018-2030 in line with global framework STOBR, aligned with ASEAN strategy with the support of OIE in collaboration with WHO and FAO. And this slide shows our LBBD and FOBO International signed the letter of agreement for the donation of 1 million doses of anti-rabies vaccine for mass dog vaccination campaign in 2018. Achievement. First achievement was the from time to time we have gained at least 70% vaccination coverage in dog population of targeted area. From in here, total of 650,000 dogs has been vaccinated from 2013 to until now. This slide shows some details of the vaccination data in pilot areas. Average working days was 25 days per township, but we make sure the coverage 70% of dog population are vaccinated in each township. Achievement 2, we have high-level engagement in this photo by the His Excellency Minister Dr. Angtu from the Ministry of Agriculture, Livestock and Irrigation, and the Deputy Minister from Ministry of Health and Support, and Naypyidaw Council member Uwe Mausei, and other our key international partner, Dr. Amir from FOBO International in this World Rabies 2019 events. We have annual commemorating World Rabies Days, September 28 since 2013, using educational talk, free rabies vaccination, participated by the high-level engagement, parliamentary representative, speaker from the Ministry of Health and Sport and Myanmar Veterinary Association, showing our One Health commitment fighting against rabies. 4 international leaders also participated in later events. And we made education and awareness with targeting to specific groups such as school children, monk, dog owner, animal lover, etc. Another achievement is since our mass dog vaccination campaign, together with intensive awareness and education campaign in 2013, human rabies cases are declined to less than 50 cases per year from time to time. Also, animal rabies cases are 0 in 2019 in pilot area after primary and booster vaccination. Achievement 4, in nationwide, we have a total of more than 470 well-trained community animal health worker, rabies dog vaccinator who actively participated in campaign. Achievement 5 is together we could able to demonstrate One Health collaboration from human health sector providing free shot of pre-exposure prophylaxis to our vaccinator before each campaign in Myanmar. Achievement 6, with the support of OIE Japan Trust Fund in collaboration and support from OIE Reference Laboratory from Republic of China, our rabies laboratory diagnostic capacity was strengthened and advanced capable to do molecular and serology testing of rabies in our key veterinary laboratory in Myanmar. Thanks OIE Regional Representative Office and Dr. Chang Chuntung for their contribution. As a conclusion, we have shown that we have demonstrated that master vaccination is doable and effective controlling rabies in Myanmar and achieve at least 70% coverage in targeted area, and human rabies cases are declined significantly. We have well-trained rabies vaccinators, and we have developed SOP and guidelines, and we demonstrated One Health collaboration is practical in Myanmar, and we have a national plan developed, and we can share our experience regionally. I would like to stop my presentation first parts in here, and as a way forward, a representative from the FOBL will continue the slides. But I will keep on moving my slides just in case.
Thank you very much, Dr. Min Tien Mao. I would like to pass it over to Dr. Marina Ivanova, please, to provide your additional information. Over to you, please.
Thank you very much, and I hope you hear me. Okay, thank you. First of all, thank you to the Tripartite for this invitation to present our joint program in Myanmar, because I think it's a good example of success. Just as a conclusion, maybe at the end, because Dr. Min Tien Mao made a very, very comprehensive presentation showing all our efforts. Of course, the main point for success, it's the good coordination and collaboration, not only between the livestock breeding and veterinary department and FAO-OIE, but also the support from the animal health sector and the local communities. This was the main reason why we were so successful and why we were able to achieve such a high number of vaccinated animals in the last year. Unfortunately, this year we had to stop. Only for the first 3 months of the 2020, we reached more than 100,000 animals vaccinated, but now due to Corona, we cannot continue. And maybe a question to Tripartite, how you would advise all of us working in the different countries to continue in this specific situation, because we all know that COVID-19 surprised us, but how we can adapt all these mass programs and how to continue further. We'll continue working with our partners, and the way forward is, of course, to unite and to work together in order to reach rabies-free by 2030. Thank you very much.
Okay, thank you very much to both of you for this presentation and for sharing your experience. I think it's very important you have demonstrated that through vaccination you can reduce the numbers of rabies cases and also reducing to zero human death due to rabies. I see there is a lot of discussion in the chat box ongoing. We're running a little bit behind time, so therefore there was also foreseen to have a short comfort break. In view of time, I would say, please feel free, stretch your legs, you are in your own working space. And I would like to pass it over for the session 3, which will be managed by WHO, and to pass it over to my colleague in WHO Vipro, Dr. Aya Yajima. Please, over to you for the next session. And thank you all for all the speakers for your excellent presentation. Thank you.
Thank you, Katinka. I hope everybody can hear me. Okay, so good afternoon, everyone. So first, let me introduce myself. My name is Aya Yajima, the focal point of neglected tropical disease entities, including rabies, in WHO Western Pacific Regional Office. So I will be facilitating this session with Dr. Gyanendra Gonga from the WHO Regional Office for the Southeast Asia. So while we all understand the critical importance of vaccinating dogs and eliminating transmission of rabies at source, we also know that scaling up and sustaining high coverage dog vaccination has various challenges and takes time to achieve. So in the meantime, we of course continue to save lives of people by ensuring that all the individuals who are bitten by suspected animals to come forward to receive full course of post-exposure prophylaxis, and also including immunoglobulin for those in need. However, we are also challenged with the global shortage of human rabies vaccine and immunoglobulin. A high cost of these biologicals also continue to hamper their universal access. So in 2018, WHO released a new recommendation on rabies immunization, as you all know, I hopefully. So the main feature of the new recommendation included more emphasis on the recommendation of the intradermal use of vaccine, and also reduced duration and number of doses for post-exposure and pre-exposure prophylaxis schedule. And also the prudent use of immunoglobulin and also monoclonal antibodies. So this new recommendation aims to mitigate issue of vaccine shortage as best as we can by increasing the number of patients treated for the same number of vaccine vials, reducing direct and indirect costs for rabies vaccine, and increasing their overall accessibility. And some of the endemic countries already adopted this new schedule and new recommendation. However, some countries have not adopted yet because of the various reasons. So in this session, we will first hear an update on the use of monoclonal antibodies as a viable alternative to immunoglobulin. Then next, we will hear experience of two countries, Pakistan and Philippines, in adopting this one-week intradermal vaccine schedule, how they overcome the challenges and what impact they gain. And at the end of the session, we will have a Q&A and a panel discussion. So the first speaker is Dr. Gyanendra Gongal. So Dr. Gongal is a regional advisor at the WHO Regional Office for the Southeast Asia, and he's an honorary member of the Association for Prevention and Control of Rabies in India. And also he served as a member of the OIE ad hoc expert group on rabies in the past. So Dr. Gongal, over to you.
I'm going to talk about monoclonal antibody as an alternative to rabies immunoglobulin. It is a kind of magic bullet which will revolutionize the use of this passive immunization in case of category 3 bite. Here, I just want to highlight that when there is dog bite, particularly in category 3 bite, it means above neck, head, highly innervated area like fingertips, and multiple bites. We need to use rabies immunoglobulin because it takes time to develop immunity once we use vaccine. So rabies immunoglobulin is ready-made antibody which is given within 7 days, and it will neutralize rabies virus at the site of bite. And vaccine, it takes 7 to 14 days to develop immunity like 0.5 IU per ml. They have to develop this antibody level to that one. And that's why it is important that we have to use rabies immunoglobulin within 7 days. So it is better if you use as soon as possible at the site of bite, and that is very, very important to save the human life. And right now, the availability, accessibility, and affordability of rabies immunoglobulin in high burden rabies endemic countries is a real challenge because there is insufficient demand and there is no supply forecasting, so there is short supply from time to time. And it is estimated that worldwide less than 2% of category 3 exposed patients receive rabies immunoglobulin. And on top of that, if we calculate the number of people who are coming for post-exposure prophylaxis, 35 to 40% of them has category 3 bite, and 60 to 90% need rabies immunoglobulin. So that is the fact we have to understand. And what is the WHO recommendation on passive immunization? We recommend use of rabies immunoglobulin. It is equine rabies immunoglobulin or human rabies immunoglobulin. And we have also recommended use of rabies monoclonal antibodies. Who should be given? Category 2 conditional with underlying medical condition or immunocompromised condition, and category 3, it is mandatory. And when it should be given, as soon as possible, but not later than 7 days of PEP. It should be given infiltration or in and around the wound only. That will save 40% of dose. And in the past, we were recommending wound plus distant intramuscular. And there is also recommendation to consider proper leveling, no skin sensitivity test before using equine rabies immunoglobulin. And the proof of concept was in 1954 when rabies immunoglobulin field trial was done in Iran by Bahmaniar. And we can see 18 head, face, bite, all wound washing and vaccine. So at that time, when they use this rabbit serum immunoglobulin in category 3 bite, 1% died, so 8% case fatality rate, whereas when they did not use rabies immunoglobulin, the 3 deaths out of 5, that means 60% case fatality rate. And at that time, sample type vaccine was used, which was given to 10 to 14 days. So this is the proof of the concept, and that we have to understand that lay down the practice of passive immunization. Currently, most countries, they are using polyclonal blood-derived rabies immunoglobulin. Historically, 2 rabies immunoglobulin have been available. Human rabies immunoglobulin, 20 IU per kg body weight. It is expensive and available in confidential quantities. And another is equine rabies immunoglobulin, 40 IU per kg body weight. Production largely discontinued due to animal welfare issue. And in order to make it more purified, there is fragment antibody binding FAV2 equine rabies immunoglobulin is available. The problem is short supply throughout the world. That is a challenge. What are the drawbacks? There is limited production capacity, small scale of production. There is no consistency in quality, batch-to-batch variation that affects efficacy and safety, and contain non-neutralizing antibodies. And it has short shelf life and safety, risk of transmission of bloodborne infection and zoonosis. There is lack of volunteers or animal welfare issue is there. Short supply because there is insufficient demand and supply forecasting is a challenge. And quality assurance, there is no WHO pre-qualification like for human rabies vaccine. What are monoclonal antibodies? These are a homogeneous preparation of antibodies in which every antibody in the product is identified in its protein sequence. And these monoclonal antibodies first generated in 1975 using hybridoma technology. And these monoclonal antibody offer reproducible, predictable, and potentially inexhaustible supply of antibody with exquisite specificity. And there is wide range of monoclonal antibody use in research, diagnosis like DREAT, we are using monoclonal antibody, and therapy of cancer like metastatic breast cancer and metastatic colorectal cancer, as well as inflammatory infectious diseases like autoimmune disorder. And this is the type of monoclonal antibodies. We can see there is murine as well as that chimeric and humanized and fully human. So basically this technology help us to develop monoclonal antibody, which is specific, it is highly pure, and it has single binding epitope. Why rabies immunoglobulin? It is highly purified and concentrated product, standardized production practices, good manufacturing practices, and there is consistency in quality, industrial production quality, capacity, increase scalability and cost-effective production, and improved safety, no transmission of bloodborne infection, and it may be cheaper in the long run, and it has long-term storage and convenience of supply if we develop this production and storage in lyophilized form. And there is possibility of WHO pre-qualification process that help us to guarantee the product. And it could fill critical public health gaps for category 3 post-exposure prophylaxis. Rabies monoclonal antibody development, it is in WHO radar in 1990. The replacement of blood-derived polyclonal antisera with monoclonal antibody is an area of active interest and has the potential. And there was 6 WHO consultation on monoclonal antibodies in rabies diagnosis research in 1990. And then in 2002, there was another consultation that recommended monoclonal antibody cocktail for rabies post-exposure treatment. And there was plan for evaluation selection of candidate monoclonal antibody and technology transfer plan with WHO collaborating centers. And what is the goal? To make monoclonal antibody product to replace RIG, which are available at lowest possible price to the public sector in developing countries. There was phase 1 to donate this monoclonal antibody by WHO collaborating center for further evaluation and then transfer of this technology to countries. And there are advances in monoclonal antibody candidate. So several this pilot project were supported in a number of countries, including India, China, and other countries. And there was a WHO meeting on monoclonal antibody in 2017. There was a selection of criteria, acceptable preclinical data, and clinical trial endpoints, ensure cost to consumer pricings, and technology transfer, Rabies Shield, Serum Institute of India, it produces, and that neutralize isolates from Asian isolate. And there is also twin-rab anti-rabies monoclonal antibody cocktail containing 2 these isotypes. And what is the way forward? Consideration of monoclonal antibody, rabies monoclonal antibody in national post-exposure prophylaxis guideline as recommended by WHO. Clear criteria mechanism need to be established for regulatory approval. Post-marketing surveillance is essential for continued evaluation for the efficacy of these products, and consumer purchase price of rabies monoclonal antibody, it is an important consideration for rabies endemic countries, and WHO pre-qualification process is important to ensure quality.
First of all, I would like to thank
Hello. Just as Aya has mentioned that WHO came up with new guideline for post-exposure prophylaxis. And that's why we introduced this one week schedule. And for this webinar, we have invited 2 countries, Pakistan and the Philippines. These countries have adopted use of 1 week intradermal vaccination schedule. First, I would like to introduce Professor Nasim Salahuddin, who is a member of the WHO advisory panel for rabies and other neglected tropical diseases. She was also a member of the strategic advisory group of experts, SAGE, working group on rabies vaccine and immunoglobulin from 2016 to 2018. And she established the Rabies Prevention Center at the Indus Hospital, where thousands of dog bites are managed each year, and healthcare workers from other institutions are also trained in correct post-exposure prophylaxis. And she was also participating in the United Against Rabies event 1 week ago, which was organized by Tripartite at the global level. Now I would like to request Dr. Nasim Salahuddin for presentation.
First of all, I would like to thank the organizers for giving me this opportunity. We face numerous challenges, none of the least of which is many healthcare workers who have not kept up with training in new products and changing regimens of vaccine and rig. Then there are problems with stockouts of vaccine and rig, so most dog bite victims never even receive PEP. Then there are people in the community who believe that PEP is so expensive and unaffordable that they forego PEP. I work at the Indus Hospital, Karachi, which is a private tertiary care, free of cost and paperless hospital. This is a view of our rabies prevention clinic, which is fully equipped for wound wash and for vaccine and immunoglobulins. You can see the rising trend in the numbers of
rabies animal bites. And this is progressively going on year after year. We have a very busy clinic with a very high throughput. We study the cost of PEP by comparing IM with ID and found that using ID's regimen is 80% more economical than IM. This is just a quick run through the history of WHO approved vaccine regimens. So nerve tissue vaccine just belongs to history. In 1973, the first modern cell culture vaccine was used, and there were two IM regimens approved by WHO, that is the Zagreb and Essen regimens, which were given over 4 to 5 doses. Full vials were used, and that was, although it was the gold standard, but it was applicable mostly to single use of individual persons. But obviously it was unaffordable for large burden clinics. So then in 1984, TRC approved the 5 ID doses that lasted, for which the last dose was at 90 days. However, only 10% of victims returned for the 3-month booster. And this really made no difference, because whether they eliminated the 90th day dose, it really didn't make a difference because everybody got better anyway. But the advantage was that only 1 vial per person was used in the ID regimen. And then in 2006, Thai Red Cross updated to 4 doses over 4 weeks, and this was effective, except that many patients did not return for the 1-month dose, and those who did complained of travel from distant areas and the expense that was difficult for them to meet. Now we come down to the IPC 1 week. The IPC stands for Institute Pasteur Cambodia. And what they did was that they found that removing the day 28 also made no difference whether patients received 3 or 4 doses. And it actually gave the same result. In other words, it was non-inferior to the TRC updated regimen, and only 0.6 ml of the vial was used. This publication of the Institute Pasteur Cambodia, the IPC, reported that 1,500 patients who were bitten by rabies proven dogs received either 3 or 4 doses. And there was no difference in the outcome. All survived. So the conclusion was that eliminating the 4th dose reduced the cost by 33% and still saved patients from rabies. Several other publications subsequently endorsed the IPC regimen. The 2018 position paper also endorsed that e-RIG products are now highly purified, and skin testing before administration is unnecessary and should be abandoned. Secondly, that RIG which was previously injected into the wound and the excess was injected into a muscle distant from the wound. Now the recommendation is that RIG should be injected only into the wound, and the remaining RIG should be stored so that the next patient who would require it for the category 3 wound, you could save it for that patient, provided asepsis is maintained. Now, putting the 2018 recommendations into practice at our hospital, we compared the number of ampules of vaccine and RIG and the cost savings between the 2017 and the 2018 regimens, as well as the safety of patients. There were about 10% more patients in 2018 than in 17. And as you can see, the demography of the patients in the 2 years, that is relating to the gender, the age, and wound categories are pretty much similar. Now to compare the cost, again, as I said, 9 to 10% patients, more patients were seen in 18 than they were in 17. However, the number of ampules that were saved in 2018 because of the 2018 regimen, we saved 140 vials and saved almost $800 US. Secondly, the number of e-rig ampules that were saved was 436 and nearly $3,500 US saved. So in total, in 2018, we saved over $4,200 US, which is not very large by many standards, but given that ours is a free hospital, this made a considerable difference. And if you extrapolate that over different centers and all over the country, it would amount to quite a lot. And also you would save on the number of vaccine and e-rig vials. Of course, we had to ensure patient safety. Now, in the absence of rabies diagnostics, we devised our own surrogate for rabid dogs. What we did was, if there were 5 persons who received unprovoked bites by the same dog on the same day, then we would assume that these were rabies-prone dogs or rabies-carrying dogs. And if we could observe them for more than 6 weeks, which is the usual incubation period, however, we would extend it even up to 6 months. And if these patients survived, then we would indirectly assume that this regimen was effective. In 2017, there were 5 separate outbreaks in which 61 victims were bitten by 5 dogs. In 2018, there were 6 outbreaks involving 56 victims, all bitten by 6 dogs. So all the patients were then reviewed on the 2018 regimen. They were contacted by phone. 50 of them responded and said they were alive and well. 6 did not respond, but we knew that they, because of telephone connections or whatever, had they developed rabies, they would certainly have been presented to our clinic. So we would say that none of the patients developed rabies. They all were well and alive, even at the end of 6 months. So in conclusion, I would say that implementing the 2018 recommendation saves vaccine and cost without compromising patient safety. Secondly, eliminating the 28th day dose saves patients a lot of anxiety, cost of travel, accommodation, and daily wages. And which is also important for us, that it frees up the space in our centers waiting areas, because those are always overcrowded, and not having them come back a month later gives us more space. We recommend that this regimen be incorporated in national guidelines, that this be implemented in lesser developed countries where there is high patient volume. It makes the regimen accessible to marginalized populations. Therefore, we can treat more patients without compromising safety. Combined with renewed public health education, risk assessments, and mass dog vaccinations, such updated human PEP regimens can help to realize the global vision of 0 human deaths by 2030. Thank you.
Thank you, Dr. Nasim. She has made convincing and practical experience of using one schedule, and we will discuss in details during our panel discussion. Now I would like to introduce Mary Jocelyn Zardeleza. She's from the Philippines. She belongs to Department of Health Regional Office, EI, and she has been working in government for last 25 years. Her work as a regional program manager is based on the promotion of excellence in the implementation of public health programs by local government units through governance, service delivery, financing, regulation, information, and human resource deployment in the whole Western Visayas region, where there was a pilot project for rabies elimination. She now works to end the human deaths from dog-mediated rabies by 2027 and enhance rabies program activities. Mary, floor is yours. Are you muted?
Good morning and good afternoon. Thank you for inviting the Philippines to share with you our journey towards rabies-free Philippines. Next, please. Okay, National Rabies Prevention and Control Program. Our vision is to declare the Philippines rabies-free by the year 2030. And our mission is to eliminate rabies in the Philippines. And our objective is to eliminate rabies as a public health problem with absence of indigenous cases for human and animal. Next. Western Visayas, Philippines, composed of 6 provinces, 2 highly urbanized cities, 133 municipalities, with 4,052 barangays in a land area of 20,233 square kilometers. Next. Our program status, animal bite cases has been increasing for the past 10 years in Western Visayas. From 2019, we have 92,130. 2018, we have 93,520. 2017, we have 100,840. And 2016, we have 83,153. 2015, we have 65,088. 2014, we have 556,238. 2013, we have 51,537. 2012, we have 41,188. 2011, we have 34,619, and 2010, we have 30,240. And dogs remain the principal cause of animal bites. You can see there is 71.9%, and for the cats, we have 27.4%, and the others, including small mammals, is only 0.6%. Next. For the list of our established animal bite treatment centers and animal bite centers in Western Visayas, Philippines as of December 2019, you can see there are 6 provinces and 2 highly urbanized cities. As for the number of ABTC and ABC required by the National Rabies Prevention and Control Program based on the population of 1 ABTC or ABC per 150,000 population, this is the strategic plan of 2020 to 2025. And you can see in Aklan, we have 4. The number of established ABTC, ABC is 2. You got 50%. For Antique Province, we have 4. Then our established ABTC, we have 7. And we got 175%. For Capiz Province, we have 5 to be required. Then we got 7. And we have 114%. For Iloilo Province, we have 13 required. And we have number of established ABTC is 19, and we got 146%. And for Guimaras, we have 1 required, then we have also 1 established, and we got 100%. For Iloilo City, we have 3 required, and we have 2 established. So we have 67%. And for Bacolod City, we have 4 required ABTC to be established. Then we have only 2 as of now, then we have 50%. And for Negros Occidental Province, we have 17 to be required. Then we got 18 established, and we got 160. So the total of number of ABC and ABTC required was 51. We got the number established of 58, so the percentage was 114%. Next, please. Next, please. For to mitigate vaccine shortages and ensure compliance of all animal bite treatment centers in the Philippines to the WHO recommendation on the new intradermal administration of anti-rabies vaccines, Department of Health National Rabies Prevention Control Program issued this administrative order 2018-0013 to update policy guidelines and procedures on the post-exposure prophylaxis and the pre-exposure prophylaxis to address the global shortage of human rabies vaccine and immunoglobulins. And you can see there, it is under the Office of the President, signed by our President, the administrative order last April 16, 2018. Next, please. Next. So our goal of this administrative order is to strengthen and fully equip ABTC in order to adhere to the standards set by the Department of National Rabies Prevention and Control Program FAO 2018-0013 using the updated two-site intradermal post-exposure prophylaxis schedule as 22200. That means we give 0.1 ml IV administration on the left and right deltoids on days 0, 3, and 7. Additional dose given on day 28 for the non-WHO pre-qualified human anti-rabies vaccine when needed if there is no available WHO pre-qualified human anti-rabies vaccine in the local market due to the ongoing global shortage. And our rate administration that shown significant savings in the volume of vaccine procured by the Philippine government. Next, please. What have we done? So we have our capacity building, and you can see in their slide, we have conducted orientation of the new device guidelines on the management of the rabies exposure, basing on our AO 2018-0013 using the updated two-site intradermal PEP schedule and RIC administration during our consultative meeting with our provincial safety rabies coordinators, ABTC, doctors and nurses, and partners. Next, please. There you are, another pictures of our training with the workers of the revised guideline on the management of this rabies exposure using the updated two-site intradermal PEP schedule and RIC administration. Next, please. Next, please. And we also conducted orientations and updates on the new PEP regimen using the updated two-site intradermal PEP schedule and RIC administration to all the private and public hospital doctors and nurses. Next, please. We also conducted orientation and updates of this guideline during the training on the National Rabies Information System to all our certified, non-certified ABTC, ABC doctors and nurses. Next, please. We also conducted the primary health care training for our barangay health workers. Next, please. And we also conducted the Rabies Awareness Month in collaboration with our partners, the Provincial Vet Office, the City Vet Office, the Provincial Health Office, the City Health Office, and the People's Organization. And we also conducted the World Rabies Day activity awareness campaign. And you can see there our IAC materials. And we also celebrate the World Rabies Day at one of the elementary schools in Iloilo, and rabies advocacy at the selected religious organization. Next, please. And we also have a rabies advocacy at the Philippine National Police Office. Next, please. And we also conducted mass media campaign, radio plugging. Next, please. And the savings for the implementation of this post-exposure prophylaxis using the updated two-site intradermal PEP Schedule 22200 and recontributes to the following: health financing established, strengthening of the animal bite treatment centers. The aim is to fully equip the ABTC to increase functionality and lower patients' pain or discomfort. Then you can see there the audio-visual equipment for the annual ABTC staff updates use, and other pictures are for the separate admission room or the triage room to ensure infection control. Next, please. And we also increase the functionality and the lower patient's pain or discomfort. There we give a fully air-conditioned facilities to ensure the quality of patient's waiting area. And there is also specific rooms for the specified needs, assure privacy of the staff patient encounter in our ABTC or ABC. Then we increase patient compliance with our PEP schedules and reduce cost of patients to travel with our ABTC or ABC. What are the challenges? Our challenges are animal bites are increasing. Establishment of our animal bite treatment centers cannot synchronize at the same speed as the increase of the animal bite cases. Another challenge is the human rabies vaccine need is increasing tremendously, and human rabies has remained significantly very high. Or another is the ongoing global shortage of the WHO pre-qualified human rabies vaccines and insufficient budget to cover the vaccine up to day 28 dose, part of the PEP vaccine and PIRIC, and has to be shouldered by the animal bite victims, which results in the non-completion of the PEP due to the financial incapacity of the animal bite victims. Next, please. And what are our major interventions? Is the provision of the post-exposure prophylaxis to category 2 and 3 animal bites in animal bite treatment centers. So procurement of human anti-rabies vaccines for an active of 6 million and 60 million and passive immunization of 5 million as augmentation to allocation received from the central office. And also to strengthen the IEC materials on immediate management of rabies exposure and responsible PEP ownership, and training medical doctors and registered nurses on the guidelines and the management of animal bite victims by virtual platform for lectures and practicum at the nearest DOH certified ABTC to be supervised by the provincial city rabies coordinator or by the DOH trained ABTC managers. Please. And also we establish for the establishment of additional animal bite treatment centers or animal bite centers, and to join efforts of rabies prevention control committees at all levels from national, regional, provincial, cities, municipalities, and barangays for the sustainability of the rabies-free areas. And we also try to give advocacy to the two national events, advocacy campaign to social media, tri-media campaign. That is our Rabies Awareness Month in March and World Rabies Day on September 28th. Thank you very much for your kind attention.
Thank you, Mary. It is interesting to know that what is going on in the Philippines, and being an island country, it should be in better condition than those countries which have land border. We are watching the chat box to stimulate our panel discussion. First, I would like to request Dr. Nasim. From your presentation, we understand that the Indus Hospital, it is a private hospital in Karachi, which is providing free post-exposure prophylaxis service to public. And it was possible because of using intradermal schedule. And we also understand that 1 week schedule is not only cost effective, but also user friendly for patients to improve their compliance rate. In this regard, I would like to ask you, what about post-exposure prophylaxis service in government hospitals in Pakistan? Yeah, Nasim. Yeah, Dr. Nasim. Could you answer what is the status of this PEP in government hospital? As private hospital, you have shown a good example that it is possible, and even you can provide free service although many people, they think private hospital means it is very expensive and it is only for rich people.
Okay, Indus Hospital is very different from most of the other private hospitals. This really caters to the poorest of the poor. Now, as I explained in our clinics, we do not only PEP very thoroughly according to the WHO guidelines and so forth, we have also adopted the 2018 guidelines. We did this pilot, this proof of concept, and now we are regularly practicing the 1 week, 3-day, 1 week regimen. We have also posted a video film which explains how to do PEP step by step. It's a 12-minute video. If anybody wants to obtain it, we'll be very happy to provide it for you. What effect it has had? Definitely it has. We have been able to open up at least 3 or 4, I think, PEP centers in other parts of the city and also in other parts of the country. People are asking for this video. It's only been very recent, I think in the last maybe 3 or 4 weeks. So it is catching up now. It is definitely going to have an effect. In addition to this, we've had a lot of healthcare workers come to our clinic for hands-on experience. And then they go back and they set up their own PEP centers. So it is definitely having a good effect.
Yeah, thank you very much. There is a common question for both of you. But Dr. Mari, you mentioned that you provide training to medical doctors and health workers to run anti-rabies clinic or rabies treatment center. So there is a question from the Indonesia that how difficult it is to train and implement the intradermal vaccination at the field level, since there is a lot of concern here in Indonesia to implement this great method. So first Mary, and then I may request Nasim how to train people to use this intradermal schedule. Mari?
Actually, there is not much difficulty for us because we already passed the guidelines. So they are following our guidelines, and the ABTC is also open to be a training hospital. So no problem with the Philippines, especially in our part in the Western Visayas. We give the training,
Dr.
and
Nasim.
it's not difficult
I
for
think
us.
training them to do inject intradermally has never been a problem. Of course, we have them come to our clinic and practice it hands-on, but most of our nurses and even doctors know how to give BCG. So it's really a very easy method for them to adopt, and they do it very rapidly within, 1 or 2 times that they can experience with the patient. As I said earlier, we also have this video which trains others, those people who are in different parts of the city or distant parts of the country. They watch the video very carefully. But we also have them, many of them come into our clinic where we give them a 1-day lectures on how to do PEP, all about rabies, and then performance of PEP, and then take them to our clinic to perform it hands-on, so that every person, every healthcare worker who joins us is now able to examine the patient, take the history, categorize the wound, and then inject the vaccine and the rig if needed in category 3 bites. And then they are instructed on how to counsel the patient so that they can come back again. So it's a very holistic approach in our clinic.
Yeah, just I want to also stress that tuberculin test, it has been done for centuries, and many people are well aware of tuberculin test. And this intradermal technique, it has now used for IPV, inactivated polio vaccine. That means they want to use fraction dose, and they are also using intradermal vaccination. So it is not only rabies, but it has been expanded to other areas. And Dr. Bharti was saying maybe we have to introduce for animal rabies also. That means vaccination also. So that is the thing. It is now extensively used in other area. And for Dr. Mary, what do you see as main reason for increase in dog bite in the Philippines? Because you mentioned number of dog bite cases are increasing. What may be the reason?
The reason is first, there are many stray dogs. And secondly, the budget in the Department of Agriculture is very minimal that they cannot vaccinate all their dogs. So as part was, we are trying to have our meeting always that they have to increase the budget for their animal vaccines, to procure the animal vaccines, because as what we have seen their accomplishment is very low. It didn't reach about 70% of animal dog vaccination coverage. That's the reason why that there are still lots of animal bites.
Thank you very much. I have a question to Dr. Nasim. You have been providing post-prophylaxis service to public for more than a decade. And how do you see the trend of human rabies incidents in Karachi?
Karachi is a huge city of a population is over 22 million. So it's almost like a country by itself. The trend really, unfortunately, is that we, along with the increase, sorry, in the population, human population, there has also been a marked increase in the stray dog population. However, as we practice better PEP, as we create more awareness, more people show up for treatment. And so when they're given post-exposure prophylaxis correctly, they survive, they don't get rabies. The problem is not so much in Karachi, in the city. However, the problem is in the rural areas where, as I mentioned earlier, there's a shortage of rig and vaccine. The doctors have not kept up with the regimens. And there's not much awareness in these areas, in the rural areas. So they go off to a prayer leader or a soothsayer and try to get some counseling from them or some help from them. So we are trying to increase this as much as possible. Now in Karachi, we have also started the One Health approach with mass dog vaccination and animal birth control. Since 2018, we did a proof of concept, and now this is catching up, and we are getting some support from the local government and hopefully from the provincial government, and we plan to expand this. It's a very slow process. It's very, very painstaking. It's a big challenge to even convince people that this is the way to go. Otherwise, they want all the animals killed. And I'm really very sad to say that today on World Rabies Day, it was up in the newspaper that 5 people have been mauled by a stray animal somewhere outside in Karachi. So we really need to scale up our work as much as possible. So we're really trying very hard with the One Health approach. On the one side, doing PEP for humans, and on the other side, mass dog vaccination and animal birth control to reduce the animal reservoir on that side. So it's a big challenge, and we're really doing it. We're going to do it.
Yeah, I have a question to Dr. Mary. There was a rabies-free Visayas, Western Visayas project, pilot project, and it was based on comprehensive rabies control. And it was launched in a tourist island, like where you are working as regional medical officer. In this regard, I would like to know what are critical factors to encourage community engagement, because that is one of the very difficult part, how to encourage people to participate in this mission of rabies-free Visayas Island.
The success of our rabies control project can be ultimately measured when the community has adopted the project's goal as its own, and that means to achieve such goal has become a way of life to people. people. Thus, community and engagement plays a very critical role to achieve success in rabies control projects towards the prevention, control, and elimination of rabies. So it's to encourage community engagement. It's a challenge during the initial phase of the rabies control project. Some of these critical factors to encourage community engagement includes tailor-fitting strategies and activities in the context of the existing social, economic, and political constructs within the community. And it also increased the awareness and understanding on rabies situation in the community and realizing that rabies is a public health problem with economic impact to the family and community, making also the community aware of the reasons why rabies prevention control is important and to their role, including ways of how they can help the prevention and control of rabies in their community. And also, of course, our political will and commitment from the local leaders, including the support and cooperation from the community-based organizations and other stakeholders, both from the human and animal sectors, to prevent and control rabies in the community. And also, we continue to promote our Anti-Rabies Act 2007, that is RA 9482, to all the possible forums and channel for information dissemination by media practitioners. And lastly, to promote dog vaccination and information dissemination on our RA 9482 among the faith-based organizations in the communities. Thank you for the question.
Yeah, Dr. Mari, in your presentation, you mentioned that the Philippines came up with not Rabies Day or week, but Rabies Month. What is the motive behind it?
To inform the community, not only in
that means you are having this Rabies Month activity, you see. In other countries, it is Rabies Day or even Rabies Week. They can go to that level. But in Philippines, you are trying to have rabies activity for whole month. So what is the motive behind it? So that is the question.
So we will have plenty of activities in a 1 month period. Because if it's only 1 day, we concentrate only 1 day or 1 week. But if it's a 1 month, we can have our vaccinations, our IEC advocacy or contribution of the IEC materials. We have our radio plugging and TV plugging, and also show talk and of course dog shows, and also we also try to go to the islands and try to give advocacy and convince them to be a rabies-free island.
Yeah, looks like
Gongal has disappeared. So thank you very much for Dr. Nasim and Dr. Maria Jocelyn. So now we will close the session and we will hand over the floor to Dr.
Well, thank you. Thank you all so much. So now we are coming to the end of the webinar for 3 hours. So thank you for staying for 3 hours. And we still have nearly about 150 participants, even after 3 hours, which shows the commitment that you all have to meet the global goal of eliminating dog-mediated human rabies by 2030. So I think I think it's less than 10 years now to reach that goal. So I think for all of us, we need to really work hard to, in all our capacities and in our position, I think we need to work hard to achieve that goal. We, just as an organizer, we would like to thank once again all the speakers for their participation and presenting on various topics, very important topics today. And also we would like to thank all the participants for your very constructive feedback and for your very active participation. We have shared the link to the evaluation. Please kindly provide your feedback through the online evaluation form. It is not very long, it's just a short evaluation form. I think it will give us opportunity to improve in future for our future webinars. So kindly go to that link and then provide your feedback. And we also like to thank all the tripartite partners from FAO, WHO, and also OIE colleagues for this collaborative approach. Now, to end this webinar, I would like to first of all invite maybe from FAO, Katinka, you have any last words to say to end this webinar?
Okay, thank you very much. I very much join your words in thanking all the speakers for their sharing their experiences and also their vision and inspiration. I think after this meeting, one comes really re-energized with a lot of new ideas on how to take rabies forward. And, you know, I think it shows over and over again the experiences that it is possible to eliminate dog-transmitted human rabies, but it requires a lot of efforts. And as mentioned by some of the speakers, we're living in the times of COVID-19, and there are new challenges, and this has sometimes jeopardized the activities, the current ongoing activities to control the disease. But I think I really liked the name of ground level warriors. I think, you know, they should all be celebrated, the ground level warriors, to fight rabies, and also having zero rabies helplines and having celebrities involved. And there were so many new ideas that came up during this day. And with this, I would like to thank you all, and also all my colleagues at OIE for excellent organization, and my colleagues in WHO. It's always a pleasure to work as a tripartite, and wishing you all a very good World Rabies Day, and that all your efforts, and thank you for all your efforts. Back to you, Kinza. Thank you.
Yeah, thanks, Katinka, for your great words and inspiration. Now, on behalf of OIE, I would like to invite Dr. Ronaldo Abela, the OIE sub-regional representative from Bangkok office. Dr. Ronald.
Thank you. Thank you, Kinsan.
Yes.
And thank you to all the speakers and to all the participants, particularly from the countries who really stayed for 3 hours to celebrate with us virtually the World Rabies Day. The problem with rabies remains the same, I would say, and we really need to still now, and it's still really resources for dog vaccination, resources in terms of budget to buy dog vaccines, which is actually cheap compared to other vaccine, but still a struggle for many of the countries with us. So I would really challenge our members, the countries, and also with the support of the stakeholders, that really we need to more advocacy to provide more resourcing for dog vaccination. And as mentioned, it's quite a challenge that right now also there are a lack of vaccines for humans, and then it's good that this monoclonal antibody that has been presented by Gongal is forthcoming, so I hope it can help. But as we know, that's only for the post-bite management, but to really prevent and eventually eliminate rabies, we have to control it at the source, and the key is dog vaccination. So it's a big challenge for us, and I hope we could continue to advocate for our ministers, our secretaries, our politicians to get more resourcing. Thank you.
Okay, thank you, Ronel, for your words of wisdom, and also for highlighting the continued challenges that are still being posed to us. So lastly, from WHO, CRO, may I invite Dr. Gongal to make the final closing remarks?
Thank you very much. As we have been celebrating this World Rabies Day for so many years, and it has been very important to increase awareness, education, and advocacy, not only at general public, but also at professional as well as policy level. And whatever we learn here, it should not be just from World Rabies Day to World Rabies Day, but we have to practice in our country. And we try to share practical experience and good practices from several countries, which we all have to continue. And we also demonstrate that even private sector, private hospital, how it can play a proactive role to provide better service using this cost-effective 1-week intradermal vaccine schedule. And as tripartite group, we are working at headquarter level, regional level, as well as country level. And there are many venues where we can work together. And by tripartite, we want to give clear message that rabies is one of the model for operationalized One Health. Unless we control rabies at source, it will remain forever. As the Dr. Nasim, she has already mentioned that she is providing PEP, but she was instrumental to advocate rabies-free Karachi, where mass drug vaccination was implemented. And now she's also advocating animal birth control, because to achieve 70% vaccine coverage, it is not easy. So animal birth control should be introduced. And now there is discussion how we can introduce oral rabies vaccination of dogs as an alternative to supplement or complement this parental vaccination. But I want to clarify that oral rabies vaccination of dogs, it will not be replacement, it will supplement to or complement to this parental vaccination. And we'll have this discussion in Indonesia on 3rd of October. And I wish all the best for all of you for your participation. It shows your commitment for rabies. Thank you.
Thank you, Gongal, for your very informative closing remarks. And on behalf of the organizer, the tripartite, the FAO-OIE and WHO, once again, let me thank all of you, the participants, the speakers, the well-wishers, the rabies fraternity of this region for your support, cooperation, collaboration. Please note that the tripartite is at your disposal. You can actually, if you have any interesting activities, any interesting projects that you would like to undertake in your country, in your region, you can always submit proposal to us, and we are there to help you. And if you have any interesting stories, any success stories that you'd like to share with other countries, with other members, please do share with us, and we can put that up in our OIE website and then share it widely. And also, we are not very far away from the global goal of 2030. They're just less than 10 years. So I think we need to walk the talk. I think just talking will not do. So I think we need to walk the talk. And for that, we all need your support and cooperation from the tripartite, and at least from the OIE, from our side, we are fully committed to supporting you all in your endeavor to achieve this goal. So as I said earlier, do let us know if you have anything that you would like us to help you, support you, whether in terms of technical coordination, collaboration, or even in terms of if you really have a good project that will really bring about visible change in your community or in your country, then we are there to support you. So with those words, I would like to thank once again all of you for this very interesting webinar, and we hope that we will see a world one day where we will not have to see people dying of rabies and also animals dying of rabies. So thank you once again, and good luck for the rest of the day, and bye for now.
Okay. Yeah. Bye-bye. Thank you all.
Thank you.
Thanks so much.